keeping you informed. KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
We hope that you and your loved ones are safe and healthy during the COVID-19 pandemic. It has been a challenging time for all, but now, more than ever, our cancer patients and caregivers need us. Although we are apart, we stand united in the fight against cancer. The American Cancer Society Guam is excited to announce our first virtual Relay for Life. Join us on Saturday, June 27th at 6:30 p.m. on KUAM TV 8, as well as on I-94 FM and streaming on KUAM News digital platforms. Cancer does not stop, and neither can we. On June 27th, let's celebrate together and fight cancer. Visit relayforlife.org/GuamGU to find out how you can participate in the 2020 Virtual Relay for Life Guam.
Be healthy. Be informed with ITD.
It's not always easy trying something new. Sometimes you have to help your loved ones along. Nana is so used to her weekly trips to the bank that going online can be a little scary for her. But her grandson knows that banking online is safer and easier. So he's teaching her how to get started using Bank of Guam's online banking videos. Teaching is one way to show our loved ones we care. Keep your family safe at home and show them how to bank online. Find easy-to-use online banking tutorials.
Panogit sa moru, purita nonda, kantai mantunat nyagitoru ilugar. Para honra, para gloria, abibai islasen para honra, para gloria, abibai islasen para gitodui tempui paz para ita dan gini langit na bende Tus protegis languam Contrai peligro na fansa fuham Tus protegis languam.
Have you ever had that feeling that made you oh so glad? Have you ever had that feeling, the memory of our land? So here we go now, here we go. Here among the music, here we go now, feel the flow. Yenene mastakilo, hina soku. Yenene mastakalo, corazón. Then he must be good and in Nasinyahu, who fresh in my saddle. Para protehi, then defendi. Hinengi, cultura, lenguaje. Airi, hano. Zanitano tamoru, yes, yes, yes. Zanitano tamoru, yes, yes, yes. Eat and shaku, la 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 la. Did I to get into stop that? 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 It's the who, what bit my ihilo, Jani Biblia, Ibandera who. Ibanderang Mohan, yes, yes, yes. 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 Ibanderang Mohan, yeah. Mastakilu, hina soku, kinini mastakalu, ikurason hu, then imas figu, nani nasinyaku, who fresh in my sadu, para by putehi, then defendi, hinengi, cultura, lenguaje. Tamoru, yes, yes, yes. Tanitano Tamoru, yes, yes, yes. Oh, yeah.
Hey, good morning. Good morning, Guam. Viva Business. It's Friday, and there's a whole lot going on. And we're going to bring it all to you guys here on Containing COVID, the KUAM News Takeover, Guam's favorite. We are KUAM FM, Agotnia 93.9. Good morning. Morning, Bree.
Good morning.
Just had to let this in a Fressy rock out a little bit. That's Zachary Lujan and the Higher Vibes band out of Washington State. Of course, he's Chamorro. You know, there's not a bunch of Luhans in Washington State who are not Chamorro. He's Chamorro. 6:30, it's Friday. Of course, there's a ton of stuff going on. We're going to go in with Dr. Hoa from the Governor's Physicians Advisory Group to talk about this latest surge. Is it a second wave? Is it a first wave? We'll find out. There's a lot of information to get out to you guys, and we're going to try and pack as much of it as we can into the next 3 hours and 30 minutes of multimedia broadcast extravaganza. We're available here on the radio. We're also live streaming KUAM.com on the KUAM News app and Docomo Channel 10. There's an audio stream. And last but not least, on the Edward R. Murrow award-winning social media networks of KUAM, good morning to our Facebook Live viewers on our KUAM News Facebook page. And remember, at 8 o'clock, we throw it on to KUAM TV 11, the last half of the show. And something to give you a little heads up on, 9:30 this morning, we're going to be playing a special performance that the Gate Theater with the Guam Department of Education had worked so hard to put on a Little Shop of Horrors, and they were scheduled to do a big performance of it. But because of the COVID, they weren't able to do that. But fortunately, we were able to get a copy of the whole performance from our friend Ernest.
Yes. So, Ernest reached out earlier this week. He wanted to do something for the kids that had been working hard on this production. And I guess they recorded something. It was edited by Matua Salas and Tim Dominguez. And they put it together. They sent it over to me. And I said, of course we're going to run this. We got to showcase our talented youth. And, Ernest, I've known Ernest for years. He has had a significant impact, at least on my daughter's life,
right?
With theater. So, anytime
a lot of people don't know, Bria, my side career as a semi-professional dancer. I was able to work with Ernest for the Sister Act performance that I did with Andy and just a bunch of people, and it was an experience. I bring my own world into the dance studio when I walk in that door, but Ernest was able to work with the talents that I have, and really
brought it out. Right?
Brought it out even more. I don't know what he could do with Jason Salas, but this is just cool. They worked so hard on it. We really wanted to give it to you guys in the way that it was meant to be seen. So we're going to do a nonstop broadcast of Little Shop of Horrors from the DOE Gate. What is it? Gate team? I don't know.
Theater.
Gate Theater. Gate SWAT team. The Gate Ensemble. The Gate Conglomerate. So we'll be doing that. 9:30, guys. They got a special message for all the graduates out there, the class of 2020, and you'll be able to watch a Little Shop of Horrors. Long story. One of my favorites, the Venus flytrap. And remember that, Ken? Yeah. And running our digital stream, we have the one and only Ken Sanity. You can follow him on Instagram, on Twitter. He is one of the most legendary men to ever pick up a gaming controller, and he's pretty good on the jiu-jitsu mat too, if you know what I mean. 6:34, you ready, Bree?
Sure.
Let's do it. Let's start the day with a dive into the day's COVID-19 headlines, and there are a lot of them, with the very latest from the KUM News team. Good morning, Sabrina Salas-Mantanani.
Hafaday, good morning, everyone. The number of COVID-19 cases jumped significantly, according to the Joint Information Center. Out of 309 tests ran through Public Health's lab yesterday, 14 tested positive for COVID-19. The results include 256 samples from COVID-19 drive-through testing held at the Agana Heights Mayor's Office and Gym on Wednesday. Meanwhile, over 500 specimens were collected at Thursday's COVID-19 drive-through testing in Jotnya and will be tested today. To date, there are 245 confirmed COVID-19 cases on Guam, with 5 deaths, 174 recoveries, and 66 active cases. According to the Joint Information Center, however, on Wednesday, a Department of Corrections employee did not report for duty because of potential illness. On Thursday, the employee went to a clinic and tested positive for COVID-19. Public Health is aware of the confirmed case and has launched its contact investigation in accordance with reporting protocols with private clinics. This case will be reflected in Guam's overall case count later today. And if that's the case, it would mean that the cases would now total 246. As for community testing, there will be none today, but rather next Tuesday in Mingilao at the Senior Center next to the Santa Teresita Church. The testing Tuesday is from 9 a.m. to 12 noon. Again, it is free. You do not have to have symptoms to be tested. Just bring your ID. She has been with the agency for more than 3 decades, and Public Health Director Linda Pinco DeNorsi is retiring. She confirms with KUAM her last day as the Public Health Authority on Guam will be next Friday. DeNorsi's GovGuam career spans 34 years and 4 months. In a statement, Governor Lulian Guerrero praised DeNorsi's experience and leadership during the COVID public health emergency. She has been committed, extremely competent, and dedicated to the health of our people. Quote, COVID-19 has forced each of us to hold even closer to those we love. Her sense of urgency, her experience, and her successes have benefited not just her agency, but the community as a whole. If anyone has earned the right to rest, it is Linda. She will be missed, and we greatly appreciate her service. That from Governor Lulian Guerrero on the announcement that Linda Pinco DeNorsi is retiring. Anne Marie Arceo, in the meantime, has stepped down as president of the Department of Chamorro Affairs to accept a position with the Commission Ifino Chamorro as the head of its new Chamorro Language Revitalization Division. She plans to lead and build the division to focus on revitalizing Guam's indigenous tongue. Former Guam Public Library System Director Arlene Santos will take over at DCA. Santos has been the acting director at the library when its board received almost 20 letters from staff complaining about her leadership. Santos went through 2 separate 90-day acting appointments but was never formally hired. Her salary was paid through the governor's office. Adelup Press Secretary Crystal Paco San Agustin says an appointment has not yet been made to the library director position, which requires a master's degree in library science. Meanwhile, the Attorney General's office is conducting an investigation into the violation of mandatory quarantine protocols by the 35 service members deployed to Anderson Air Force Base that tested positive for COVID. In response to a request from Speaker Tina Muñoz Barnes, AG Levin Camacho said he believes the military is refusing to provide necessary information to public health to determine whether protocol was followed. He says although the military provided general information, they have not been forthcoming with information that would confirm this was not a systematic failure to follow our local rules. Camacho saying, quote, what we are left with instead are actions that resulted in the spread of COVID-19 and endangered members of our community. This is unacceptable. No one is above the law, not even the military. The 35 Air Force service members who tested positive for COVID-19 visited as many as 30 local establishments in apparent violation of restricted movement orders. Public Health is now tracing the group's stops that were mostly in Tumon, but also extended as far south as Talafofo, Agate, and Santa Rita. The list of establishments released late Wednesday by Public Health shows there were 11 dine-in stops, and the rest were for restaurant, takeout, and 2 convenience stores. The list is available on our website. Joining us now with the latest from the CNMI is our Tomas Manglotnya, who is reporting live from Saipan. Good morning, Tomas.
Good morning, Bree and Chris. Here's the latest making news in the CNMI. The Commonwealth Healthcare Corporation releasing a new video in the CNMI explaining operations for the hospital, talking about emergency rooms, safety, and addressing medical emergencies. We are going to play this clip from their team about the new operations amid the new normal. Take a listen.
The pandemic has made many people in the CNMI afraid to seek emergency medical care, even when they need it. Coming to the CHCC emergency room does not mean that you will be exposed to the virus. We want to assure everyone that we are taking all necessary precautions to keep our patients safe. All ER patients are screened, and those with symptoms of COVID receive care under an added level of isolation. Thorough cleaning and sanitizing is also occurring in the ER and throughout the whole hospital. Our staff, patients, and visitors all wear masks and practice social distancing. If you or your loved one is experiencing a medical emergency, don't wait. We are prepared for all patients, and we are prepared to keep you safe from the coronavirus. I don't want anyone staying at home worrying about whether or not they should come because of the coronavirus. I'd much rather see you quickly in our emergency room and reassure you or treat your symptoms and send you safely home or admit you to the hospital for further care. If you are in a situation when you are not sure if you need emergency care, this can be when your child has a fever or an injury like a potentially broken ankle, you can call our teletriage service at 670-233-2067.
Hello, Hello, this is Zelda Triage, Dr. Nelson in the ER.
From all the staff at CHCC, we remain prepared, committed, and ready to care for you. Your health is our health.
Released last night from the COVID-19 task force says that PUA applications are only available at the CNMI Department of Labor office in Capitol Hill. JKPL is no longer an application center for PUA here in the CNMI. According to that press release, the CNMI Department of Labor is informing the business community and government agencies and the public that Jotankizo Public Library will no longer be an application center for the Pandemic Unemployment Assistance Program. All PUA applications and inquiries will be handled directly by the CNMI Department of Labor staff. Copies of the PUA applications they add may be picked up from the Department of Labor office in Capitol Hill, Building 1334, located on Ascension Drive. The DOL office is open from 8 a.m. to 4 p.m. on Saipan, Monday to Friday. And again, they're reminding folks to prevent the spread of COVID-19. All visitors to the DOL office are required to wear a face mask and keep distance as instructed by the staff. And of course, you can find more information as the CNMI DOL upgraded its HireMarianas.com portal. And an update as of June 25th, we have some of the latest numbers for the CNMI on the CHCC's COVID-19 dashboard. The cumulative number of confirmed COVID-19 cases in the CNMI remains at 30, with 2 deaths. The Saipan has tested over 7,000 people, Tinian has tested just over 400, and Rhoda has tested nearly 600 people. Of course, the community is waiting to hear plans for village-based testing that is expected to roll out early next week. Bring Chris, that's the latest making news here in the CNMI.
Thanks, Tomas. From the Department of Labor, GDOL announces the release of $36.4 million, which is the second batch of payments for initial claims without issues filed through June 4th for PUA. The claimants can expect to receive these payments early next week. With this second batch, the total amount paid is now $78.3 million, with $6.3 million going toward taxes. The department reminds applicants that PUA payments are retroactive to those who qualify, but that benefits no longer apply to those who've gone back to work at their regular hours prior to the pandemic. The weekly threshold of $494 or less to be eligible for PUA only applies to applicants whose work hours have been reduced as a direct effect of COVID-19. Employees who have received paychecks through the Pandemic Payment Protection Program, or PPP, also do not qualify. However, they may be eligible for PUA for the weeks they do not receive PPP. For those who have been approved for benefit disbursement but have had their electronic fund transfers bounce back for reasons such as inputting the wrong account information, the Department of Administration will automatically issue paper checks and then mail them to the addresses listed on the claims. The process could take up to 10 days. Please do not contact DOA to find out if your application has been approved and processed for payment. Possible reasons for applications not being cleared may include applications missing a picture ID, limited or absence of documentation, a lack of work history, or having an off-island bank account. Despite Defense Counsel Joseph McDonald's efforts to get 49-year-old Anthony Gregory Manjola released from custody, Magistrates Judge Benjamin Sison ruled that he remains behind bars on a $50,000 cash bail. A magistrate's complaint charges Manjola with murder as a first-degree felony with special allegation of possession and use of a deadly weapon in the commission of a felony, possession of a firearm without a valid ID as a third-degree felony, and possession of an unregistered firearm. He is accused of fatally shooting Joey Matsanani Zamora on Monday, June 23rd at his residence located along Tutuhan Drive in Agana Heights. Attorney McDonald argued his client's rights were violated since he has been in custody for more than 48 hours, and also argued his client is immune from prosecution under Castle Doctrine. Assistant Attorney General Sean Brown referenced the magistrate's complaint, saying a witness saw Zamora enter Manjola's home, heard 3 gunshots, and exited holding a firearm. Further stated in court documents, when officers asked where Zamora was, Manjola said, "He's inside, I shot him." As for the Castle Doctrine matter, Assistant AG Brown says, quote, "Let's see it in writing so we can hash out the details." Ultimately, the court found probable cause and told the defense he is free to file any motions. Manjola's next court appearance was set for July 2nd at 4 p.m. with presiding Judge Alberto Lamarena. The U.S. Department of the Interior awards nearly $3 million in technical assistance grants to the government of Guam. According to the breakdown, $1.2 million will go to the Guam State Clearinghouse for the digital archival of historical government documents and historical records in the Guam Public Library system. Almost $367,000 will go to the Guam Memorial Hospital Authority to train nursing and revenue cycle management staff. $310,000 to the Office of the Attorney General for financial forensics training. $310,000 to the Department of Land Management for its IT upgrade, equipment, and supplies. Another $300,000 to the Bureau of Statistics and Plans to modernize Guam's customs and import operations. $95,000 to the Department of Education for internal audit and financial affairs training. $58,000 to the Department of Public Works for a new CCTV system and barcode inventory system, and $334,000 to the University of Guam to develop professional curators. The Guam Visitors Bureau says it's time to get your hands dirty and help clean up Guam. The Visitors Bureau is all set up for tomorrow's island-wide beautification event. GVB has also launched a new video campaign focusing on Guam as a safe and healthy tourist destination. Board members got the latest updates during a meeting yesterday. Chairman Sonny Atta.
I think we should have up to over 1,000 folks participating, so the number keeps growing. And the emphasis is that it's not just for the tourists, it's also for us. We do have a campaign for Give Us a Moment Together. It's a two-prong. One, there's a local piece, and then there's one for our source markets. Basically promoting safety, how Guam is safe and ready to welcome visitors.
For more information on the island-wide cleanup, you can check the GVB website. In national news, George Floyd's death under the knee of a police officer in Minneapolis sparked weeks of protests nationwide and calls for police reform. Now the House is on the verge of passing legislation named in his honor. Skylar Henry has more details from Washington.
The House is prepared to pass a police reform bill on the 1-month anniversary of George Floyd's death.
It was not until the advent of the cell phone camera that the stories of police abuse were finally exposed to the world. Before then, the deaths were simply disregarded, not believed, not acknowledged.
The bill includes a ban on chokeholds and would make it easier to file civil lawsuits against officers accused of misconduct. Those two provisions are not included in a Republican Senate bill that Democrats blocked Wednesday.
This bill lost because it was woefully inadequate. It never would have passed, and McConnell provided no path to improve it.
Republicans accuse Democrats of being unwilling to compromise.
My friends on the other side just said no. Not no to the legislation. They just said no.
President Trump says he doesn't support any bill that hurts police. The president is also promising to prosecute protesters caught damaging statues. This is one of the statues demonstrators want to tear down.
The FBI is investigating hundreds of people throughout the country for what they've done to monuments, statues, and even buildings.
The president says he will sign an executive order to further protect the statues, and he tweeted that they are some of our great works of art that represent our history and heritage. The Army has activated but not yet deployed 400 members of the Washington, D.C. National Guard to prevent any further damage to the monuments. Skylar Henry, CBS News, Washington. Washington.
In your Banking 671 report, Coast 360 Federal Credit Union was recently honored with 6 Diamond Awards, which recognizes outstanding marketing and business development achievements in the credit union industry. The awards were presented by the Credit Union National Association Marketing and Business Development Council, which is a national network comprised of over 1,200 credit union marketing and business development professionals. Awards are given in each of 35 categories ranging from advertising to community events and beyond. Coast 360 won in 4 categories for its new youth banking program, one for its annual report, and ultimately garnered top honor of Diamond Best of Show. For its youth banking program, the credit union won categories best in the following: complete campaign, membership marketing, plastic card design, and point of sale and merchandising. And that is your Banking 671 report, sponsored by the Bank of Guam and Coast 360. And finally, just a reminder that KUAM will be broadcasting and streaming the first ever virtual Relay for Life on KUAM TV 8 and on our social media platforms. That is tomorrow at 6:30 p.m. It's going to be an evening of hope and inspiration. We'll hear from survivors, volunteers, leaders in the organization, researchers, and we'll cap the evening off with a special Luminaria ceremony. And that is your news.
Thank you so much, Sabrina.
Welcome.
6:51. Wow, what is going on? A lot of resignations, retirements.
I don't know.
I mean, I agree with what the governor said. If anybody deserves to rest, it's Linda Pinko D'Onorsio. We'll try and get her on the show this morning. I know that she's been kind of skittish since the whole signature thing.
The recalling,
right?
Not recalling the call.
I think that what ended up happening is that she just didn't want to discuss it anymore. I mean, how many times did she address that on the record? And I just feel like she just was. That's why you didn't really see her a lot in the media, other than the press conferences. So we'll try and get her. 6:52. Someone we can get right now, Dr. Hoa Wen from the Governor's Physicians Advisory Group. Obviously, a man we definitely want to talk to as we are seeing a rise in the number of COVID-19 cases. Of course, they kind of explained it away on the military side by saying that, oh, these are the airmen, they're isolated on the base. But now we come to find out last night that we had 14 positive COVID-19 cases not on the base, outside in the community. And we'll get Dr. Wen on to see exactly what he can tell us about that, if anything. Good morning, Doc.
Good morning, guys. Good morning.
Good morning.
Good morning, Sabrina, Chris.
You sound very grave this morning. Is that?
Gosh, I'm almost scared to ask a question. What's going on?
No, we all scratch our head too. It's a big spike. 15. We don't have that for a long time, but those are not related to the Air Force.
Right.
Positive. Okay. This they're not cluster. They're kind of everywhere. So that's sometimes it's not a good thing because we'd rather have in one place. But the good part about the majority of them are kind of there's no symptom or very mild symptom. I think 4 of them are symptomatic, more symptomatic that we can worry about, and I think 1 end up in the hospital. So we have 1 COVID positive in the hospital. So we have to kind of look at all the positive, and we have to take back and do some PSA again for the public that as we open more establishments, we have to really follow the mask and social distance. It's very important because it's where if we going to start have some more positive in the community or not, we find out the next weeks or so because we open more. So we just have to be re-educate the public again to be very cautious and not let their guard down again. So we just hope for the best. We still, I think, going to go to PCOR 3 because the 7-day average, we kind of in the borderline. But I think we still going to go PCOR 3 for now. I think.
No, that's just going to freak everybody out.
When are you hearing that we're going to go into PCOR 3?
I think by the end of this month. So
okay.
The next 2 days.
Are you looking at the governor also lifting this public health state of emergency on 1 July or 30 June?
I'm not sure. That's a very tough call just because we definitely don't want to go backward. We definitely don't want to do that. But
what if we have to?
It's not going to be a good week.
Doc, what if we have to go backwards because of this spike? I mean, do you think that we should move into PCOR 3 or, from a medical perspective, or do you think we should remain in PCOR 2, or do you think we should go back? Because I feel like this 5-day rolling average, we were holding that out as the gold standard of what it took to roll us back. But, now that, like you said, we're borderline in meeting that, now we're saying, the hospitalizations, there's only 1. So
Just curious, because it kind of seems like there's a difference of opinion between those who want to reopen everything from an economic standpoint and those who are in the medical community. They seem a little bit more cautious in that when we talk to people from public health, when we talk to the doctors, they seem very key on reiterating how serious this is and how we shouldn't take it for granted and how we should, stay home if possible. So there seems to be a little bit of mixed messaging here. So that's why I want to ask, what's your opinion on it?
We right now Pequot 2, and most of the business is open already. The only thing is not open to tourists. Pequot 3 can open to tourists. We're never going to get to Pequot 4 just because we have no vaccination treatment. But in reality, we can open the tourists, but no tourists going to come because right now every country have a 2-week quarantine. So, we won't see that for quite a few weeks or months or so. There's a very little between the 2 and 3, except that the tourists open because I think the majority of all the businesses in Guam are open already in some capacity. We have to really look at our hospital, GMH and GRMC, to make sure that we have the capacity to handle if any surge in hospitalization. So that's the only major point that we look at to go from 2 to 3. Test capacity, the tracking and tracing are already in place. The number of cases, that's something we didn't expect. But again, if we look at the 5 or Sunday average, we still kind of that a little bit at that borderline where you say, "Wow, it's what happened." I think it's still safe. We still ask her to go to Pequot 3 still, and hopefully we can stay that way. Again, public health with Chima and the team, the tracing team, they doing a very good job so far in tracking all these people down and working with the Air Force. But like I say, the 15 cases we have and the 560 we have the other day have no relationship to the Air Force personnel at all.
Yeah, I know you're saying that as like kind of good news, but I think it's a little scary that even though we haven't seen an impact from these airmen, what we are seeing, like you said, is 15 positives scattered throughout the island.
Yeah, I think that's part of Christopher Sabrina. You guys really have to push this part, and the PAC, we're going to do the same, and really tell people to really put their mask on. And a lot of my patients concerned that we have signed that no mask, no entry.
Right.
But when they enter a certain business, they put their mask down, they walk around, and that's a no-no. I tell you, you had to put your mask on to do that. So this is not talking about restaurants that they put a mask down to eat.
Right.
I'm talking about the other store that they go in there with a mask on. But once they're inside,
right.
The employee really need to monitor, make sure that the customer always had their mask on inside the store.
Doc, you don't have to tell us twice about the mask thing. I mean, we've really, because we take it seriously, our role in the media. I mean, part of our job is to get the information that's crucial to people and to get it out there. And I think one of the most crucial things we can do is wear the mask. And people have turned it into some kind of stupid political debate, which I don't understand. It's really a public health issue. By wearing the mask, I'm not spitting in your face. And, it's just safe. It's not just safe for her, it's safe for me. I mean, I got 5 kids. They have elderly family. We're doing our part, and we're trying to really set the example. And I just got to call out some of our media colleagues because they've, really, it's a bad example. And I think with people watching us all the time, I want to set a good example. I want to say stay home. I want to say wear your mask. I want to say wash your hands. So we're taking it serious, Doc, and I just really wish that all of our colleagues across the board in media would do the same and not treat this as some like Republican Democrat thing, because it's really not. I mean, it's Republican, Democrat, COVID doesn't discriminate.
It doesn't. And the other one too is that people on home quarantine, they really need to be on home quarantine. There's between home quarantine, there's a restricted movement, but the home quarantine, I would say that we bat about 50% of our folks are truly home quarantine, and that's where you have to worry about, people that come in from off island, including the state. If you are home quarantine, we really have to have your home quarantine and not, go around and back to quarantine. We bat about 50, 60%. And that's what the danger is about, having people fly in from off island. On our meeting, we come up with, things change every day, and people criticize why we change every day or every meeting, every week that we come up with new idea, just because situation around the world change every day. So we come up with new guideline again, and it's going to take probably 7 weeks to come up with this thing, to kind of have people try to test out of the home quarantine a little bit earlier. But we try to catch the most positive as possible. But we're going to try to get people off the home quarantine. Some new guidelines going to come out soon. It's a lot of heated debate in the PAC group to try to move this thing forward. We have 7 weeks to try to work this thing out, but we really need to somehow, because we have the testing capacity, not like we have unlimited testing capacity, but we have enough to roll out this thing as a program to see if it works, to make sure that the home quarantine at least get tested. Because right now I tell you, people are going out when they are supposed to be home quarantine.
Right.
And also ask people that if they have any cough and cold, do not go to work, and you have to go see a physician. And don't show up to work, because if you're positive, you are going to affect a lot of people. And sooner or later, if you have a positive work case, just imagine you have to send your office worker home for another 14 days, and we don't have no worker anymore. So it's very important people really pay attention. It's like Chris said, you got to respect your colleague, you respect other people around you, because this is not an easy thing, And the other thing is that we really have to pay attention to all the positive. It doesn't matter if they're symptomatic, not symptomatic, because the young, because most of them are young right now, and there's a few older ones. But if you have a positive on a young person that have mild symptoms, guess what? Sooner or later, they're going to pass it on to their elderly in their family or their neighbor, and those at the high-risk patients. Our hospitalization will go up if we don't pay attention to the mild symptom that's positive for COVID-19. So it's a lot of education out there. We have to do the public in order to keep our island go and continue on PCOR 3. Nobody want to go back to PCOR 2.
Right.
But if we have to, we have to. I feel like that we're just not going to go backwards, and that the government, that we're firm on, we're going to reopen tourism no matter what.
If our hospitalization go up, we have one right now. We don't have one for a long time. GMA used to be 0 for a long time. We have 1. So hopefully the trend does not continue to go up and it continue to go down. But I say it needs the whole island to work together in order to keep where we are. Okay. So.
I wanted to go back into that home quarantine. So you're saying that there may be this change in the protocol where people that are on home quarantine, which would probably be, Guam residents, returning Guam residents, could test out?
Yes.
Within what time frame after they land on Guam and they're at home?
We ban it from 5 to 7 days. It's a lot of logistics thing we have to look for. Guys, we have to look for who's paying for it. That's number one, right? Insurance not going to pay for it.
Okay.
Because that costs a lot. And, you can't expect Guam to pay for the test all the time. because this is looking for months, maybe a year. So sooner or later, the money's going to run out. So we have to look at where can people go to get tested. Not all the facility, like public health or private clinic can do testing. So they have who to do testing on those patients to test them out, because you still have to take some precaution, because that you are testing somebody that potentially is positive. So those are details, the cost, where, and who monitor. That the quarantine personnel will come in on the 7 days. So those are the steps that we have to discuss and look at and put in place before we roll out the program. Just like Wyoming, they put their target is August 1st, so they have the whole month of July. It's not like they can roll out the program right away, because all those are very complicated to put in place.
Okay, so target is July 1st. That's what you just said.
No, we cannot. No, July 1st around the corner. So this is going to take probably 7 weeks for us to come up with.
No, August 1st. You said August 1st?
Yeah, August 1st.
August 1st.
Yeah.
I wanted.
That's what we trying, but like I say, there's a lot of things have to be in place.
Okay. I wanted to ask about the government quarantine facilities, because we've been seeing numbers there with people that have been testing positive, mainly from the Philippines. And we just started seeing flights coming in or returning from the Philippines to Guam. Are you guys having any conversations or concerns about that, and also discussions about the possibility of testing when people arrive?
There's few positive from the PAL flight already, but they have been moved to Days Inn. That's the isolation facility. So I'm not sure where they are right now, but they are a quarantine facility. But once the test positive, they will move off to the isolation facility. The PAL flights, they have like 130, 140, and there's 180 something, but a few of them have medical problems. I know that a few having an exam to be quarantined at home because of medical necessity. That's what people come from St. Luke that cannot stay there. A few, but the plan is to test everybody and on the facility, just to get just a clear picture of what the prevalence is of the COVID-19. Because we just need to feel comfortable before we let people go home. Because like I say, the main thing is we don't want to go backwards. And a lot of people, complain that discriminatory, whatever reason is. There's no discriminatory in this one. It's judgment to try to protect the island. And we're not going to do this for a long time. That's why we come up with new guidelines to try to get people, doesn't matter where they're from, to go home as soon as possible. Because there's no one like to be quarantined in the government facility. But like I say, this decision had to make to really protect Guam, and there's no discriminatory on this one.
So I'm sorry. Did you just say that the plan is to test everybody in the quarantine facilities?
Yes, the plan to test. I think they'll be rolled out this weekend.
How many quarantine facilities do we have now?
We have with the first test is Saturday. I think it's about 130. So it's not that many from the first flight. So that's the number that we are comfortable with in running it. So there's no problem with running at 130 tests. Let's just say we run almost 300-400 tests. So that is a very doable number.
And was there any discussion on changes in the protocol for tourists that plan to or may not arrive when we reopen on 1 July?
There's a lot of talk on no tests for tourists coming in, and we right now.
No tests for tourists coming in, and no quarantine.
Yeah, even we roll out as July 1st, right? We expect 0 tourists to come in for the next several weeks or months. What you understand is that when the tourists come in right now, even we relax and everything for them, when they go back, they have to have 2-week quarantine period in their country. Nobody will come. But at least when we put the guideline out, the tour company can plan months from now. It's not just next week. Their country have to relax their policy before they can go anywhere. Japan, Taiwan, Korea, they will not let anyone come back to the country, including their residents, without have to be 2 weeks quarantine if you leave your country. So it doesn't matter what we do. They're not coming until that country relax, and we don't. Taiwan putting the dateline out sometime October. So the only way that we can look for our tourism to return to Guam is to put any type of letter out, so that way the tour company. I'm not a business, but we have to look at listen to business people. I'm just a physician, but when we took our business people, it takes months to plan for this tour. It doesn't take days. So if we don't plan ahead of time, from months from now down the line, that we try to get our tourism back to the island so our people can have their job back, we would be stand still as we are right now. So the decision of open for tourists with no test or anything like that is really pending. We can put a letter out, but if situation change in Korea, situation change in Japan and Taiwan, those things will be changed again. But right now we just need to put something out there so the tour company can start planning months down the line. No tourists going to come July 1st, guys. Absolutely zero. Just because...
not even one.
Not even one. That country will not let them leave. Because they go back, they have no choice. It'll be 2 weeks quarantine. So they rather go on vacation within their country at this point, as Japan encourage people to take their vacation, their leave within their country. So it's not like they're going to come. So, people don't worry about, say, there's no test or for no requirement of tourists. They don't understand the concept. The concept is start to plan for the future several months down the line, because it's not going to happen July 1st.
Okay. What about over at the Department of Corrections? The news came out last night, but the individual started not feeling well on Wednesday, tested positive yesterday. And you guys met last night, right?
Yes, we met last night.
Was that discussed about what happened at DOC?
We discussed shortly, public health on it, the person at home, and they're going to test every people there at DOC. And, the key here is that the person, the lucky person seek medical care when they sick. That's the right thing to do. And if you do that, you won't pass it to your coworker, especially if your workplace implement face-on all the time. Just like my clinic, you can't take your face off, your face mask off. And most of the business now, when you're at work, you have your face mask on. So if you do that, then the chance that you catch anything from your coworker, and your coworker respect you by, I'm sick, I'm staying home, they can't spread anywhere. So, but public health going to test the DOC, and lucky this person came early, and hopefully there's no more positive case in a DOC in the workplace.
When is the testing for? You said all the officers are going to be tested. When is that? And are the inmates also going to be tested?
Yeah, that's Chima and public health, Dr. Manglona, will have to make that decision. But right now they're pretty aggressive. So,
but that's the plan, that everybody over there is going to get tested.
Yeah, no, guys, they are very aggressive, and they've we lucky part, and we are very fortunate in Guam that we have the capacity to do that at this point. If the surge gets a lot more, then we're going to back the question mark. But at this point, with the number of cases we have, they have the capacity to go out there and do cast a very wide net, so that way we can catch everything that can be catch possible. So, so Yeah, we leave it to Mangonia and Dr. Mangonia and Chima, and they will make sure that they identify the positive and isolate them.
Mm-hmm.
Okay, so
Doc, so with public health currently working on the contact tracing for the airmen and the 30 businesses that they went to when they defied their superiors' orders, do you think that we have enough contact trace investigators to also contact trace investigate the 15 new positive cases that we have?
Right now we have, I know public health hiring a whole bunch of more people to be in that department. For us to be open and to be comfortable, that department had to be very strong and tracking and tracing. That's the only way that we can get out of this mess. So they are high. I know Acton said they hired something like 40 people yesterday. I said, well, good. They need to hire a lot more, just because we need to make sure that we are all in place in case something happens. Mm-hmm. Because if they are strong, we can basically identify everyone, and we will keep our number of cases low and warm. Mm-hmm. Because right now, besides the COVID-19, they have to worry about all other kind of stuff, like TB positive and all that kind of other infectious disease. So right now they borrow people from different departments, but we, as a PAC, we really push them to hire a lot more people to do the work for. They make a lot of phone calls a day,
right?
And they drive everywhere. They have right now like almost 1,000 people on home quarantine. Just imagine 2 phone calls a day. Mm-hmm. That's a lot of phone calls. So,
but I thought this whole EMOCA app, I think it's EMOCA, right? This EMOCA app that Public Health announced, I thought that was supposed to help keep track of where people are and what they're doing, and you're supposed to send little videos and things like that. Is that working? Are we still using it?
You have to call. You still have to call for them to turn on the video. So someone actually has to sit there and call them.
Okay.
So that's why I say there's a lot of phone calls that have to make throughout the day, and sometimes they drive to the house or spot check. So there's a lot of stuff that this team here, and I tell you, there need to be 100 of people on that team. So that way we can feel comfortable that, hey, people don't violate the quarantine at home.
Yeah, let me know. I got a few nosy aunties who would be really good contact trace investigators.
We might let the mayor involved too. That's one subject that we talk about, and I talked to Melissa Savage a little bit, and we still trying to figure out what extent that we can get the mayor to get involved. If they want to get involved and kind of help, make sure that people in their village and the quarantine and that stay at home and not go anywhere. The mayor can do that. They know everyone in the village, and that would be very helpful because we don't have enough people in public health to make sure they stay at home.
I guess, Doc, in closing, if you could, people waking up to this news this morning, 15 new COVID-19 positives outside of the military bases, and you're saying they're not connected with the airmen who defied their supervisor's direct orders. So what's your message to people as they wake up and kind of deal with this news in what's supposed to be the new normal?
The message to people is wherever you go, be cautious, wear your mask, all the time, in public, wash your hands, and respect the person next to you. And if you happen to, by any chance, not intentionally, you take your mask off, and someone come up to you and ask you to put your mask back on, don't get mad at them. That's the responsibility of every person here on this island to try to keep us clean. Mm-hmm. That's the message.
Also, before we let you go, we did speak with Linda and Pinko DeNorsi actually earlier this week about her retirement. You have anything to say about that?
Is there anything fishy going on with it, Doc, or is it just really she's tired?
Was she in the meeting last night?
I tell you, she's probably beside her going to have so much stress in her plate. Some of her employees work from 7 in the morning until 11 at night. I don't know how she can stand it, but I tell you, she has her plate so full. People can take so much stress at a certain point, and I applaud her that you have to know when you push your limit because you're gonna break down if you pass your limit. We go down this thing for about 4 or 5 months now, and I tell you, she got to be burned out. We lost a very good person to head of public health, but I tell you, she got burned out. I mean, even I look at other some of her staff there. They look like they walk on the water too. I mean, it's just like they burn out. There is so much, we didn't never expect this for a small department to be that take on this much responsibility. But all of us, and no one perfect. She makes mistakes, and everyone makes mistakes. But at a certain point, you have to know when you have to back out. So
you're saying she's stressed? She reached her limit.
Yeah, I mean, she's stressed. And I mean, all of us are stressed. My doctor's stressed. They all freaked out yesterday, and my physician, look at the number. We were trying to relax the protocol in the clinic, but now, I'm glad we didn't relax the protocol because we have to go back to be very cautious on what we do in order to make sure that our patients are safe and our employees are safe. It's just a lot of stress. It's a different type of what we live in until we have the treatment and the vaccination for the COVID-19. Hopefully soon. But I just say farewell to Linda and I say thank you for everything she has done. She did a wonderful job.
Right.
Who's taking over?
I'm not quite sure. I met with Josephine O'Madden, multiple times. And she looks like she's fully capable.
She also has a lot of experience.
Yeah, I don't know, but Joe been there for a long time already.
How about Tom Atta? Did you hear anything about Tom Atta heading public health?
No. I just say bye to Tom and
Tim Uggan.
Tom Atta, and he's a wonderful person to work with too. But
Doc, sorry, I know we're trying to let you go, but somebody had a question about the rolling average, and I know that's Dr. Cabrera's baby, but what can you tell us about the rolling average? I know you discussed it earlier, and you basically said that we haven't met that criteria to roll us back, right?
Yeah, we haven't met. We are very close to it, but that's what they call rolling average because you don't want one spike to you don't want to make a decision out one spike, so you have to do a rolling average to kind of balance out everything, and we are in the verge, but we didn't pass it. Today we have 10 to 12 today, or we're in trouble.
Right. Knock on wood.
Doc,
yes.
I wanted to follow up on something you talked with us about a couple weeks ago about this pilot projects with the Japanese School of Guam and these smaller schools, and any monitoring what's going on with these children and these classes as we move forward to making final decisions on the reopening of schools. Do you have an update on that?
Yeah, I'm glad you mentioned it. I forgot to tell you that. The pilot program of Japanese school going as well as you can expect it. It's a beautiful program, and I know that St. Anthony and some private school are asking for the guideline, and they try to implement that too. Dr. Bird and Dr. and a few of the physicians, Dr. Dulai, in the committee, in the subgroup there, they will put a report out on the study so people would know. But it's a very successful program right now. It's wonderful. They present some picture yesterday of the classroom, how the interact each other, and like I say, I know St. Anthony are asking for the guidelines. A few other private school are asking. So they all want to get the guidelines to try to plan for July or whatever deadline they try to open their school. But we going to present this to public health and get a blessing on them on the final report of the pilot program that have been going on. The Japanese school is open now. People are going to school, and like I say, it's very, very well put together, and there's actually no kink at this point. So this program can roll forward to the private school and to DOE. If I know they're going to try to meet with DOE, but I'm not sure where the program is. But I think the lieutenant governor take over that. So the program. So hopefully he can push this to others part of the school, public school also.
How many students are at the Japanese school?
I don't know. They have very small. I think less than 100.
Okay.
Wow.
Okay.
But it's just very well done. I tell you, you guys should ask Dr. Burt and Dr. to talk about it. It's really well done.
Right. We'll follow up with Dr.
We will. We'll get him on for Monday.
Yeah, it's really. I'm very proud of them. We'll take the initial step to do that. Kids during the summer, they need to, especially special kids, they need to be occupied because they lose a lot of learning here. So, we're going to try to push it out, like I say, and get the central website that people can access to, and put some picture of the school there, and help the private school and public school move forward.
One thing that Dr. was mentioning when we interviewed him a couple of weeks ago was the children not wearing masks.
Yeah.
Is that true from the pictures, I guess, that you had seen?
There's still, that's a guideline that we put out, and the school has the ultimate decision. The Japanese school decided they're going to make all the kids wear masks. So every school can make their own decision on the mask. We give a basic guideline, and they can go beyond that if they want.
Okay, we'll go ahead and wrap this interview because Chris is giving me
go
the
ahead.
evil
Bree,
eye.
I'm not giving you the evil eye. Go on, Bree.
No. This stuff interests me, but that's okay. We can check with Dr.
No,
Dr.
go. You want to ask him anything else?
No. I'm good.
Yeah,
Thanks.
they will fill you out, and what they presented last night, we're so happy that it worked out very well for everyone.
All right.
Right on.
Okay.
Thanks.
Okay, guys.
All right,
Have
Doc.
a good day.
Watch your stress.
Thank you so much.
Wear a mask.
Okay.
Wear a mask.
I will.
Wash your hands.
Guys. Have a good day.
All right,
okay.
bye.
All right.
Bye-bye.
7:28. What'd you think of that, Bree? I told you guys.
That was a lot of information.
It was a lot of information.
Possible home quarantine testing out.
Right.
QFAX. They're going to be doing testing everybody tomorrow.
QFAX is quarantine facilities, guys.
Oh,
I know Bree's way deep in this quarantine procurement facility thing, expert. But QFAX is quarantine facilities. So that's one of the things he said was they want to go in and test everyone in those quarantine facilities, and then also everybody on home quarantine. That's for returning residents.
Right, but that would be they're still working on the home quarantine testing out program because there's a lot of details that they have to work out, and it probably would be where you would have to pay that out of pocket.
Right. And I what I meant was I told you guys I felt like I was thinking this morning that with the news of these 15 positives that the messaging was going to kind of be it's still not enough to roll us back, Yeah.
And there's also a hospitalization over at the Guam Memorial Hospital.
Right. And we have Lillian Posadas from the Guam Memorial Hospital coming on in the 8 o'clock hour, so we'll definitely ask her about that. 7:29. Let's keep it going with the phones here. There was an advisory that was issued by Joint Region Marianas, and this advisory basically barred Coast Guard, Navy, and Marine personnel stationed on board Guam from dining in restaurants and going out to bars. That was supposed to go until the 25th. However, it was extended until July 1st. And then we saw yesterday a similar order come out from the Guam and National Guard. And that order has since been modified just a little bit. But we wanted to bring Mark Scott from the Guard. He's the new PIO on to kind of talk about that. Good morning, Mark.
Good morning, Chris. Happy
Good
Friday.
morning.
PAO, Public Affairs Officer.
Public Affairs Officer, right. Okay, got it.
So many acronyms I know in the military.
Too many. So we'll just give you the floor. Go ahead and explain, because we got a lot of Guard listeners. So what do they need to know about this latest order?
So the main thing here, the commander's intent, our TAG's intent, really is to protect the health and safety of our community and our forces. And you guys know that if we're tasked with helping keep the island safe, we can't do that, right, unless we keep ourselves safe. We're being depended on, right, to help out in the QFACs and to help out at the PUA sites and food distro sites and all the different things we're doing. We can't support that unless we keep ourselves healthy. Right? As soon as we start getting sick, then we can't perform. So that's the intent behind this memorandum. And as you guys can see it, I sent it to you this morning. It's nothing more than what you just said. It's a prohibition for all of our full-time support staff, our uniformed folks, from entering establishments, sit-down restaurants, and bars, just to keep us in the fight and to ensure that we can continue our mission.
Mm-hmm. And this is just basically following in line with what the military is doing. I mean, well, you guys are the military, but with what Joint Legion Marianas put out earlier this week.
Well, we all have our guidance from DOD, and in our memorandum, you can see there it says there's a DOD instruction 6200, off the top of my head, point 3, I believe. And there's also Governor of Guam executive order that we're all nesting under, right? So this isn't just guidance that we're kind of making up as we go. We're aligned with the governor on our one side, and then we're aligned with DOD on the other side, which is our two bosses, right? So, yes, it's similar to what you'll see at JRM, right? Because we're kind of on the same page as far as keeping ourselves safe so that we can continue to serve.
And I also saw that you guys are conducting a little bit of some cleanup this morning. Mark, what can you tell us about that?
Yeah, we're out there this morning. So as we start to consider opening up the island back up again, we want to make sure everything is presentable and clean. The conditions are as clean and sanitary as possible. So there's an opportunity to help. We're out there picking up trash this morning at Paseo, down at Two Lovers Point. We had about 120 some folks out there with bags, raking up leaves and just getting our island back to the state of readiness that it needs to be.
Yeah, because of all the things that the Guard is doing these days. What about testing of Guards members? Is that
we did that.
Okay.
Yeah, we did that. We had the test come in from the Diagnostic Laboratory Services folks under the umbrella of Public Health. We came in and we tested all of our Joint Task Force, and this was over the last week, I want to say. So we all tested negative, which is good news. And yes, Sabrina, that was done.
Okay. How many are we talking? How many people?
Our Joint Task Force right now has, let's see, we have about 250 or so total on the operation, and approximately 100. But you know what, Sabrina, let me get a better number back to you later.
That's
let me
fine.
just get that.
Is that mandatory testing, or you can say you don't want to do the testing?
We didn't have anyone say they didn't want the test. So the test kits come up, and it's the kind of thing that we all voluntarily want to know, right? We don't want to be performing our duties and we're infected, right? So even though it wasn't a mandate, we didn't have anyone that did not choose to take the test for our own sake and for the community's sake.
Okay. Is there anything else you wanted to get out that the Guard has been doing?
Nothing new. So we still have all the different operations and task forces out there. I'm sure the folks have seen us, whether it's at the mayor's office for the public testing or the food handout, helping out with traffic, or at the QFACs. One new mission that we do have is helping out with the contact tracing that we just talked about with your last caller there. We are sending some folks to help out with that effort.
Oh, wow.
Yeah, so we are still busy. We got things going on, but on behalf of the TAG and the governor, the only thing I'd like to say is thank you. Thank you to the people of Guam for your continued support, and thank you to you guys for calls like this and helping get out our message. We appreciate you all.
All right, Mark.
All right, thanks, Mark.
All right, thanks, guys, too.
Wash your hands.
Yeah, you too. Thank you.
Okay, bye. There you go. Hey, let's take a quick break at 7:34. The KUAM News Takeover, Guam's favorite, and containing COVID is back next. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
We hope that you and your loved ones are safe and healthy during the COVID-19 pandemic. It has been a challenging time for all, but now, more than ever, our cancer patients and caregivers need us. Although we are apart, we stand united in the fight against cancer. The American Cancer Society Guam is excited to announce our first virtual Relay for Life. Join us on Saturday, June 27th at 6:30 p.m. on KUAM TV 8, as well as on I-94 FM and streaming on KUAM News digital platforms. Cancer does not stop, and neither can we. On June 27th, let's celebrate together and fight cancer. Visit relayforlife.org/GuamGU to find out how you can participate in the 2020 virtual Relay for Life Guam.
Be healthy. Be informed with ITD.
It's not always easy trying something new. Sometimes you have to help your loved ones along. Nana is so used to her weekly trips to the bank that going online can be a little scary for her. But her grandson knows that banking online is safer and easier. So he's teaching her how to get started using Bank of Guam's online banking videos. Teaching is one way to show our loved ones we care. Keep your family safe at home and show them how to bank online. Find easy-to-use online banking tutorials at bankofguam.com or on our Instagram and Facebook pages. Bank of Guam, member FDIC.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
We hope that you and your loved ones are safe and healthy during the COVID-19 pandemic. It has been a challenging time for all, but now, more than ever, our cancer patients and caregivers need us. Although we are apart, we stand united in the fight against cancer. The American Cancer Society Guam is excited to announce our first virtual Relay for Life. Join us on Saturday, June 27th at 6:30 p.m. on KUAM TV 8, as well as on I-94 FM and streaming on KUAM News digital platforms. Cancer does not stop, and neither can we. On June 27th, let's celebrate together and fight cancer. Visit relayforlife.org/GuamGU to find out how you can participate in the 2020 virtual Relay for Life Guam.
healthy. Be informed with ITD.
Good morning. Hey, good morning. Yeah, we're just so excited about this mango Bucci Bucci. I know there's 15 positives out there. But it's like our stress eat, you know what I mean? It was like 15 positives. We need mango Bucci Bucci in Empanada this morning. 741, Biba Bitness. Interesting conversation there, of course, with Dr. Hoa. 15 COVID-19 positives, so public health definitely has their hands full, and also dealing with the news that their director is retiring. Her last day on the job next Friday. So that was definitely a bombshell. But someone who's not retiring, we'll go to the Mayor's Council of Guam. He's the vice president. He's also a member of the Guam Visitors Bureau board. Send on you, Mayor Robert Hoffman. Morning, Mayor.
Hafidi, good morning.
Good morning.
Thank you for playing that Hagu song. It's a nice song for one written by one of our Sinahanya's very own, Flora Bazaquan.
There you go, and that's great. There's a lot of different covers of that one. That's one of the ones that I really dig. Mayor, let's just start on the cleanup. So I'm sorry, forgive me. You're the vice chair, right, of the GVB board?
Yeah, so we're talking about, no, I'm the vice chair of the Beautification Task Force.
Okay, I got you.
And so on that, so we actually are having this discussion this morning to see, we are getting people texting and calling, asking, what's going on. We are going to, we're, as far as I know, we're still proceeding social distancing. We have about 1,100 plus volunteers, but everyone's going to be broken down into little groups spaced out well. Like my family's going and we're just doing a stretch of road by ourselves, get to get our bags, do our thing, and then kind of work from there. So, but we'll leave it to the rest of the powers that be and the people that are going to make the recommendations. I think we're all waiting for the groups to meet this morning, the physicians groups and public health, to figure out if these positives were a cluster or are they individual homes itself. Because, in the last 2 weeks, we've had protests, we've had waves, we've had the reopening of the churches. Yeah. So it could be anything. It could have been anything.
Father's Day.
Father's Day, and then the I guess the growing from 10 to 25 to 50 in the gatherings. So, and there's been a lot more funerals that I've seen people actually attend. My uncle himself, when he passed, different. So I think it's these things we're trying to see what these cases are and where they came from in that, and then they have about 500 more tests they still need to run. So
from Jotnia.
That's one thing.
Yeah, that was the turnout at Jotnia was insane. I mean, it went from.
I don't know if it's all Jotnia or it's a mix of others.
I'm sure there's a lot of Southerners, right? But it went from the church at one point all the way past the feed store, almost a 7-day supermarket.
But with that, because I think their capacity is they can only do 60 to 80 in an hour, because it takes time to fill out the paperwork and to do it. Because we tried to how many, we're all trying to set our records and get people out to do turnout. But most of the time, it's always between 240 to 260. That's why you've noticed that every time they do the village results, because that's pretty much based on the capacity of public health to do these things through. If you had 4 testing stations or, whichever. So I was shocked to see the 500 number, but we'll find out where those actual breakdowns are, because sometimes it just clusters saying, okay, this is Jotnia, but it could be somewhere. And one thing that I was talking about this morning is I really think that the military should kind of step up, and since they broke the protocol, they should come out and start testing those businesses and restaurants and their families too. I think that's a good way to do that. If I was the admiral or the general, I'd be like, get your testing team out there. Right. We need to fix this too. And so it really shouldn't just be relying on public health. If they have the capability, they should be out there testing. And I think
one Guam, guys. I thought you said it's one Guam. Where you at?
Has anyone made the ask?
I
don't
that
know.
we
Maybe
should
I'll
have to,
do that here. I don't know. My lowly position as a mayor of a small town, military, if you're listening, it would be, I think it'd be incumbent on them to do that, especially the fact that they visited so many places at that one time. I think it would not necessarily bring some sense of comfort, but it makes them take responsibility for the action in that sense to say, hey, you know what, if you're a business and you're here, come over to the Naval Hospital or to the military gate, or we'll come out to you and tell us where you work, and we're really sorry, and we want to see you and just make sure you're safe.
It kind of seems like they're doing the opposite. They're just turtling in. They're just like, no, we're going in our shell.
Yeah. Nobody come out the gate.
Right,
Close.
yeah. Nobody go to the restaurants or the bars.
It's like the medieval times. Raise the drawbridge.
Right. Mayor, let me ask you about, so you said that people are talking about this cleanup, that you're waiting on the groups to meet. You're waiting on more information about these 15 positives and whatever results we get today. It kind of sounds like there might be a chance that this thing could be called off.
It might be postponed, but right now, no. We're waiting. I think we're still ahead. I mean, remember the last time we had that huge number? I think it was in Jigo. It was in a household,
right.
So it was able to kind of understood.
Right, but we had Dr. Hoa on earlier, and he said that they were scattered. That a lot of these cases were not connected to each other.
Yeah, and that's why we're asking for more information of where did they, in these last 2 weeks, were they part of protests, part of churches, part of this, because that will kind of tell you where that spread is, right. I guess, and so that's kind of what we're asking and what we're requesting for is, where is this? Because, we're going to start backtracking. It's going to be the hardest thing that public health has to do. I feel for them, and this is where we can probably reassign some of those non-essential agencies to start going up there. And I understand all about HIPAA and everything, but I would be like, you know what, just go up there and start making calls and find out where.
This is like a recurring theme. Mayor's asking for more transparency and information. I think I heard this one before.
Here's a good oldie but goodie hit.
Right. The SIT report comes out like around 12 to 11 to 1 or something like that. But even still, it doesn't have like a whole lot of specific details in the SIT report. All it's like, oh, we might have contact to a confirmed case or no contact at all.
Yeah,
that's what we saw yesterday.
Yeah,
right? What was that?
Which one?
There was one case, one female
who had contact, and then the rest, I think it was like the 3 others or 4 others, no contact.
Yeah, so it's a challenge for us to even also when we get that. So we're asking for more. It's slowly but surely we'll see. And we wish Linda well on her, her retirement. I know she's.
What'd you hear, Mayor?
I know she cares for her father-in-law.
Right. Yeah.
Who's very sickly, very elderly. He's a wonderful man, and so. I know that they all co-shared, and co-helped out this, and for the past few, she's been quite busy. So, and I think she hasn't been able to be around the father-in-law, considering her position everywhere she is at it. What her
Mayor, I'll text her at like 8, and she'll be like, "I'm still at work. I'll get back to you. Let me find out." Mm-hmm. I mean, like, and that's like the
very demanding job. So,
right? Yeah.
If there's, I'm sure that. The front office is actively looking for replacements for that and for other other agencies that have that. But
what do you think, though, Mayor? Because in the comments, people are saying, "Oh, everyone's abandoning ship." What's your read on it? Do you think it's just a bunch of coincidences?
Most people don't last long in any type of government. 18 months is usually the thing. It's stressful. You kind of sacrifice a lot of your life into doing a lot of things, and nobody expects. Most disasters like typhoons and other stuff, they last a little bit. You do your thing, you go. This has just been the long haul. This is the marathon of, emergencies. So it takes a toll on people. And so I think, for her, it was probably a hard decision. She was up to the challenge. She's up to the challenge. She did it since day one, and everything else that they're trying to do. I know they've made great strides in some points compared to the states and other territories, but at the same time, you're faced with this is government, this is people's attitudes, this is all these other things. So for her, but it's her personal reason. I'm not going to second guess why, but I think retiring either for medical, caring for a family member is always something that's hard for somebody. But caring for a family member, that you're doing God's work that way. It's hospice care.
Right.
It's never easy. If anyone's ever cared for somebody sickly or in bed, that's one of the hardest things to do, is because you basically I have a friend who cared for his sick mom and his aunt for basically all his life as a kid, and his mom just passed away. And I told him, I said, "What are you going to do now with your life?" He goes, "I don't know. I've always just been home hospice care."
Right.
And so it's a reality check for him, and he's happy the mom is finally resting, but at the same time it's like, what do I do with my life? I've never had a social life. After school was taking care of this, doing shifts, and so yeah, it's hard to do hospice care, but I wish her well, and we wish all the others that are leaving for whatever reason, we wish them well. Those are their decisions.
I wanted to follow up with the homeless situation. I think, aren't you with the Guam Homeless Coalition?
I'm not in the Homeless Coalition, but I'm tasked by the Mayor's Council to help during this emergency pandemic. I know that they're actively out looking for facilities, properties, and places, and trying to gather all the agencies that receive some type of CARE Act funding to deal with specific issues regarding homeless and poverty. So it's kind of bringing everybody together.
The Lieutenant Governor, he said that by Monday of this week, that he should have some answers, but we're still waiting. This is like the fourth iteration of trying to find a hardened shelter. We heard from a mayor earlier this week. Which one was it?
It was
Mayor's Council Executive Director
Angel Sablan said there was a Mong talk to my team.
And yet
we were looking at that, and then I think the issues are also, it's GSA also has the final say in terms of things, and it's just, there's not many available spaces where they're all in together. There's not one place that's like, all 100 units or 40 units are empty. It's going to be a mix of people here and there. So it's harder for either the people, the nonprofits, or the agencies are going to be watching it to be deployed to several different areas to do these things. So, a lot of the things that are part of this emergency services will be food, will be how do we, get them to do the other things there, protecting the neighbors and stuff.
But John Birch, when he was the director of Parks and Recs, and they kicked out the homeless in Paseo and other parks so that they could, start cleaning up. What are we going to do tomorrow? Because we're hearing that, some of the homeless people are still in Agana, at Paseo.
Yeah. So last night we had conversations with the mayors about the opening the use of their gymnasiums, as well as we do in typhoons in terms of Tier 2 shelters. That was one of the discussions we had. What we're also finding is some of these gymnasiums have plumbing issues. They're very hot. And, there's a whole bunch of other issues. Some of them, the roofs leaks. They were actually supposed to undergo construction and reconstruction, and several of them through a Parks grant that was given about I think it was more than a year ago. So kind of the timing became very bad. So it's still something we're actively looking at. So the next, but that was a discussion today, was check your colleague mayors. And we did. I had discussions with, we suggested, how about the Dedo Sports Complex area, because I think they're going to give, I think right now we're trying to do the priorities of that, families, and then, go down that line. But that's one aspect of it. And then it's, like I said, it's the agencies finding out what kind of CARE Act money they have that can go to this specifically, and then finding the right balance of how much are we willing to pay, where we're not going to say, if you're going to pay for a shelter that's going to be like, $1,500 to $2,000 a month, you might as well give the person a voucher to rent a house on his own. Why a 1-bedroom or a 2-bedroom, or do we do it in a communal setting where you just get one room in a house of 4? You get one room, and we just all have this communal space, and they kind of do that. So it's how to proceed safely because of Corona. That's going to be the hard part, is keeping everybody within that. And then what do they do with their daytime now? If they're leaving their things there, where do they go? Are they going to just hang outside the neighborhood, and are they going to hang outside the...
Mayor, it sounds like we're not going to get or are we going to get a resolution this week? Because LT said yes. DPW Deputy and Acting Parks and Rec Director Jess Garcia said, yep, this week.
I know that they are out. I know they did meet with landlords. They've met with realtors. They've met with people. I know GSA's out there. All three groups are doing their work and out there, and same thing with us is, I wait for my assignment, I go do it, and I come back and report. And that was my report last night was, we have plumbing issues. We have these other issues here. Then some of the schools are located where the grab and go is still happening. And there's also, the talk of the summer, how do we do the summer classes and stuff. So those are some of the issues we're facing. And then, feeding them, the logistics of it, and then who's going to help do this and help them organize it, because it's hard for the government to do it, in a way, if everything's kind of open and back to normal.
Right. Yeah, I think 3 months is not a long enough time to plan something out like this. So
That's sarcasm right there. So.
Oh, no, and that's the thing is that, you know, I always tell people that it's 104 days of the mask. And, you know, yes, granted, this is very new for everybody here, but some of the times just anticipating things. So I'm a logistics guy. I like learning about logistics and trying to figure out. And so I'm anticipating for the next thing. And the next thing is, how do we shore up and stand up some of these services faster? Because God forbid it would have been something that required it immediately. Where, you know, what if there was a super typhoon and, you know, suddenly you had thousands
typhoon
homeless?
season.
How do we do this and how do we shore this up? So, you know, we're learning. Are we doing the best job of it? We're trying on our end. The other agencies are trying, but there's restrictions here and there, and it's hard when you're a small island and you're limited to sole sourcing and, you know, limited to the availability of spaces, and you know you can't truck in a bunch of trailers from another state that's not being used, or so we do have our challenges here.
But we've also learned that you can totally bypass procurement rules when you have superpowers. So you can do.
When you're a soldier and you can,
you know,
yeah, that's not there. There are processes for some of these things, and so I think with housing specifically, it falls under a different region, different oversight, and I think those guidelines. I think I remember reading it. That those guidelines are still the same, no matter.
So are we going to kick out homeless people today, get them out of the way, so that we can do this cleanup tomorrow?
I don't know. That's my department on that end there. So I'm just trying to figure out our end here and trying to get as many as we can. And so.
But the latest plan is now, or that's circulating. MTM is out, and maybe the Dededo Sports Complex.
Is MTM
is that the
officially out?
I don't know. No, I don't know.
Okay.
I don't know. I was just asked to look for other places while they're trying to secure other places. So we're actively engaged in talking with them, because that was the natural choice, was the tier 2 shelters. But now that we know the conditions of the shelters are not even capable of doing long-term type of care, you know, a few days like a typhoon, it's pretty easy to do. It's the longer term of, you know, how long will you need this?
And I think that's what the governor said in the last press conference. So she's like, I don't want to just house them. I want to
wrap around
house
services.
them and get them jobs. And
if they need, you know, they need to go into drug rehab programs or other things. And so, you know, the discussions are there and they're taking place.
For the last 3 months.
Yeah.
Okay.
Okay, Mayor. I know we got to ask you about this whole COVID differential pay. I don't know if you saw the story, but I mean, it was funny because Bree and I, we weren't disagreeing about this. We just brought up different points, but I thought I was thinking about it last night. It was like, we have basically been praising you guys for how hard you've been working during this COVID pandemic. We know that, you know, you're out there delivering meals, coming into contact with people. You don't know if they're COVID positive. And so I really felt like you would be able to justify not just you receiving the COVID differential pay, but so many of your colleagues on the Mayor's Council. So we'll just give you the floor and go ahead.
Thank you. You know, when we kind of saw that, it was, you know, we're saying, okay, well, first of all, it's 15% on our hourly. It's not a year's salary. I think so. We were saying 50% of 75,000. Like, no, unless this thing lasts for a whole year, then maybe, but it's not on that end. But it's paid by DPHS, you know, by Public Health through the CARES Act, through their funding, and it was given to them, I guess, for local governments. They were able to see how it's done on that end. It wasn't an ask of the Mayor's Council at all. It was saying, give us everybody that's working COVID, tell us what they're doing. So some of the things we were doing is, you know, within the first week, we were securing and cleaning and decontaminating our facilities. And then we were always doing, you know, periodic checks on the parks, enforcing social distancing. You saw the litter pictures. Those are the things kind of we were doing on that end. And, you know, these are actual mayors doing it. Some people say, oh, that's the staff. You know, you saw mayors out there doing it as well. You know, for me personally, I use my POV. We delivered meals to the homeless twice a day. That's what we've been doing, you know, since then. I use my own gas on that end. You know, we're helping do all the recreation stuff, businesses, packing, and, you know, helping curb a lot of stuff. We still carried on our duties as that, but these were the additional COVID duties. You know, we coordinated with agencies and departments for the logistics to include the grab and go, the DOE education stuff that we had to send out there. We did the TFAP lines, and the lunches, and we're still doing the lunches. Actually, if you go to several districts, you're going to see the mayor out there helping with the grab-and-go line. That's what they're doing. We're assisting the schools a lot more, and we had for the last 3 weeks the USDA fruit boxes, and I know Mayor Savard.
Yeah.
You guys should have just handled the homeless shelter. My
Right.
goodness.
And then the Mayor Savard personally was transporting patients from the hospital to their homes. And, that's in her car. And she's like, I'm going to get corona. I just know it. And, it's hard because these people don't have family or facilities, or people are like, I'm not picking them up because, they just got released. So we know that's happening there. We organized the drive-through testing with public health. We're helping DPHS do the tracing and backtracking. We're actually even showing them physically where some of the houses are, going door to door. We did the Manumco food. That was one thing we did, and then for like us in Sinahanya, my vice mayor, we put up the help center, and he's been doing interviews and doing intake. So there are things a lot of the mayors did not see. We don't go around taking pictures, putting it on Twitter, and saying, "Look at me, this is what I'm doing."
Making
We
videos.
do our jobs. We get in, we get out. We're, that's what
You
we
guys
do.
need a video guy. Like maybe you could borrow Adaloop's video guy.
Well, we were actually talking about it on Tuesday in our little meeting. We said, you know what? Instead of Liberation, we were going to personally all pay for an ad to really thank our employees, because everybody's always thanking the doctors, the nurses, which is granted,
Right.
yes, they are, but it's you don't see much videos of us saying thank you, mayor's people, for
Right. No,
trying
thank you to
your
the
best.
mayor's staff. I know all the mayor's staff. They work very, very hard, man.
I
Hard
appreciate you
and
giving
never
us the time.
stop. Essential all the way. I got it.
Yeah, and the thing I was going to say, they say, why do you get 50%, Mayor? I said, because I got to call Chris Barnett and Sabrina in the morning, and I'm not even on the clock yet.
You don't even know what they're gonna ask, right? Yeah.
I'm just teasing.
I got you. Well, thanks.
Appreciate it.
Hey, keep us posted on the cleanup. If there's going to be a postponement or what, we'd like to know.
I will. Appreciate it.
Because
Thank
we're
you.
scheduled to clean too. We signed up.
I mean, I'm kind of like 15 positives. I mean, I'm not saying that's my excuse, Bree, but I mean, it is what it is. Okay.
Yes, we will, and hopefully maybe the military steps up to the plate and starts doing testing as well.
Right.
There you
Good
go.
call. Thank you, Mayor.
Thank you.
So wash your hands. Okay.
Bye-bye. I will.
All right.
And wear a mask.
And wear a mask. 8:02. We'll take a break, come back, do our anthems, jump into the news, and then we have Lillian Posadas from the Guam Memorial Hospital. We'll definitely ask her about that COVID hospitalization. And Attorney General Levin Camacho also coming on. And then a lot of crime, unfortunately, a lot of crime going on. So we'll catch up with Sergeant Paul Tapau of the Guam Police Department. It's the KUAM News Takeover, Guam's favorite, containing COVID, Biba Betness.
Restaurants across
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
We hope that you and your loved ones are safe and healthy during the COVID-19 pandemic. It has been a challenging time for all, but now, more than ever, our cancer patients and caregivers need us. Although we are apart, we stand united in the fight against cancer. The American Cancer Society Guam is excited to announce our first virtual Relay for Life. Join us on Saturday, June 27th at 6:30 p.m. on KUAM TV 8, as well as on I-94 FM and streaming on KUAM News digital platforms. Cancer does not stop, and neither can we. On June 27th, let's celebrate together and fight cancer. Visit relayforlife.org/GuamGU to find out how you can participate in the 2020 Virtual Relay for Life Guam.
Be healthy. Be informed with ITD.
It's not always easy trying something new. Sometimes you have to help your loved ones along. Nana is so used to her weekly trips to the bank that going online can be a little scary for her. but her grandson knows that banking online is safer and easier, so he's teaching her how to get started using Bank of Guam's online banking videos. Teaching is one way to show our loved ones we care, keep your family safe at home, and show them how to bank online. Find easy-to-use online banking tutorials at bankofguam.com or on our Instagram and Facebook pages. Bank of Guam, member FDIC.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
Panogitsa moru purita nonda kantai mantunat nyagi toru ilugar para honra para gloria abiba islasen para honra para gloria abiba islasen para todo y tempo y paz para ita dan gini langit na bendición contra y peligro na fansa fuham Deus protege Island Guam contra y peligro na fansa fuham Deus protege Island Guam.
Gotta love it when the computer freezes. 8:10. Good morning on you. It's the KUM News Takeover, Guam's favorite KUAM FM Agotnia. Good morning to our TV 11 viewers on KUAM TV 11. Of course, the Edward R. Murrow Award-winning social media networks of KUAM, our KUAM News Facebook Live show. Thank you guys so much. We're on the radio, 93.9, KUAM FM Agotnia, Guam. There's an audio stream, Docomo Channel 10. And we're on the KUAM News app as well. All right, and it's all proudly brought to you by Ambrose Inc., IT&E, Coast 360, Calvo Enterprises, and the Bank of Guam at 811. We're going to do news in just a sec, but we wanted to bring on the acting director of Parks and Rec and the deputy director of the Department of Public Works. Are you have any other titles, Jess?
You're not like a public health director, library?
Are you at the airport director now, or?
Good morning, Chris.
Good morning.
Oh, morning. So we just heard from Mayor Hoffman that there was, is there some kind of delay in the awarding of the bid for the homeless shelters?
Yes, so as you know, that to get these facilities, it would have to go to the General Services process, right?
Mm-hmm.
GSA.
Mm-hmm.
So we're just waiting for the answers from GSA to see if they had found locations so we can actually confirm.
So, we heard from Angel Sablon earlier this week. He mentioned that there was a location, apartment complex in Mongmong Totumaiti that might be the location for the Harden shelter. Is that now off the table?
Yeah. Sabrina, so there's different locations. People are putting in their interest into the what we're requesting for, and everything would as everybody submits their interest, they would have to be reviewed to make sure that they meet with what the requirements that we're asking for on the bid.
Right, but isn't there a deadline to submit a response?
There is a deadline, so I don't know what the deadline exactly is, but it's being actively worked on.
Mm-hmm. Were there bids that came in or responses that came in that were determined didn't meet the specifications that were required, and then
that's what GSA is looking at. So when they submit a bid, it goes through the process, right? They see if they meet the qualifications and stuff like that.
Yeah, but it just seemed like everybody was kind of confident that we would have something set to go.
Yes, you're right that everybody wants it to go through, but we gotta make sure it's done right. We don't want to just award and then it's not the right way to do it. It's a complex thing.
Please don't go there.
It's not just getting a place for the homeless. We gotta think about the intake, right? When we receive the homeless, we gotta have them screened. We don't want to put people together in case they have some kind of ailments or whatever. We don't want to have it spread, so they have to be screened. There's a screening process. There's a lot of things. It's not just getting a place and putting them in, and then we might compound the problem more.
Right, but isn't GSA's responsibility is to handle that side of it, to ensure that the wraparound services are in place, or is it their responsibility to find the location or decide on the location?
Yeah. So the wraparound, so that's all part of the thing. Are we getting a building with the wraparound service, or are we just getting the building and then we have to source again another wraparound service? There's different things, Patty. Sabrina.
Oh, Lord.
Sorry. Sabrina, to this thing, right? It's not, and we want to make sure that we're going in the right direction. We don't want to award and then we say, oh man, we forgot this thing. We want to make sure that it's all going to work in harmony to get this thing done for the homeless.
Mm-hmm. So the government doesn't provide those sorts of wraparound services?
Well, that's why it's real complicated. This is the first time we're dealing with this kind of thing to get it running. There's it's been talked about in the past, and now we have to do it because of this pandemic. Mm-hmm. It's difficult. It's not a...
Right. No, I understand, because it's taken 3 months. So are you saying that the likelihood of having this done today, having things signed today, is now likely not to happen?
I'm not too sure we can put the package actually fully together today. So we're going to see what.
So we're looking at putting together another package?
I don't know yet, because that's why I'm saying it's difficult, because there's things. So if we award for a building, so who's going to manage the building? Do we have people to manage it? Is it going to be an agency? Is it going to be? It's really hard, Sabrina. It's not a easy thing to deal with this issue that we're dealing with, the homeless.
Yeah. And I only ask this because it just sounded like we already had thought about this, because why would we say that we're so close?
So they were planning stuff. So as we discussed the issues, there's things that happen, right? So they're saying, if we do this, we have to have this in place. You know what I'm saying, right?
Yeah, I do.
Give one, and then we're going to say, oh, shit, we gave out the house or the building for them to be in, but now what's our next step? So we're trying to make it work where when we give it out, it all falls together.
I just feel like we've been hearing this for months already. I mean, I don't feel like we have.
I'm on the team, so I'm trying to get a better handle of what's going on. So I'm trying, and the team is trying to get it done.
Yeah.
What are we going to do in the meantime?
I don't want to give something and then it's not what we expect.
Right. This is Jess Garcia, Deputy Director of Public Works and also the Acting Director of Parks and Rec. So what are we going to do in the meantime, Jess? We spoke with Mayor Hoffman, and he had said there was some discussion about sticking the homeless in gyms.
Well, that's one of the things, and I'm pursuing it as we speak to see what's our best avenue to at least take care of the immediate issue of the homeless, right? So I'm involved with the group, so I'm sure I'm not going to make it. If I'm going to do it, I'll make sure that we get whatever we say we're going to do.
That's it. They brought in the Terminator, Jess Garcia. He's going to terminate this, get it over with.
I'm going to help the process to get it easier, so just to make sure that it gets done the right way.
So if we go and do the cleanup,
it's a team effort here.
Right. Yeah. But Jess, if we go and do the cleanup tomorrow and we're cleaning up Paseo, are we just going to clean around the homeless, or how are we going to work that? Because remember, they were...
There's so, like Paseo, for example, right? So that's under Parks and Recreation. So I'll make sure that whatever was done... Actually, I already started doing the cleanup since I got it. So it has to be a regular thing. You let it build up, you get more trash. If you do it every day, it's very little to clean. Just a maintenance issue.
Okay. So what's going to happen? When can you give us new info, Jess?
As soon as I get it, man, I'll call you, Chris, and let you know.
Yeah.
But right now, I'm trying with the team to solve this issue.
Right.
All right.
Because everybody's barking about it, and we need to move on and get it done.
So you're taking it serious, housing the homeless?
Yes, sir.
Thanks, Jess.
Thank you, Jess.
Thank you.
All right.
Okay. Wash your hands. Oh, there you go. Jess Garcia. Good morning. It's 8:19. We will take just a little break and come back. We've got to dive into the day's COVID-19 headlines, and then also Lillian Posadas, the Attorney General, and Sergeant Paul Tapal, the Guam Police Department. That's next on Containing COVID. Good morning.
Posters, stickers, keeping you informed. KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
We hope that you and your loved ones are safe and healthy during the COVID-19 pandemic. It has been a challenging time for all, but now, more than ever, our cancer patients and caregivers need us. Although we are apart, we stand united in the fight against cancer. The American Cancer Society Guam is excited to announce our first virtual Relay for Life. Join us on Saturday, June 27th at 6:30 p.m. on KUAM TV 8, as well as on I-94 FM and streaming on KUAM News digital platforms. Cancer does not stop, and neither can we. On June 27th, let's celebrate together and fight cancer. Visit relayforlife.org/GuamGU to find out how you can participate in the 2020 virtual Relay for Life Guam.
Be healthy. Be informed with ITD.
It's not always easy trying something new. Sometimes you have to help your loved ones along. Nana is so used to her weekly trips to the bank that going online can be a little scary for her. But her grandson knows that banking online is safer and easier. So he's teaching her how to get started using Bank of Guam's online banking videos. Teaching is one way to show our loved ones we care. Keep your family safe at home and show them how to bank online. Find easy-to-use online banking tutorials at bankofguam.com or on our Instagram and Facebook pages. Bank of Guam member.
Comment from our Facebook Live feed. Daisy writes in, again, the homeless are pushed to the back burner. I don't even think they're in the kitchen anymore. 822, containing COVID, the KUAM News Takeover, Guam's favorite. And it's all proudly brought to you by Ambrose Inc., IT&E, Coast 360, Cabo Enterprises, and the Bank of Guam. Good morning, TV11, our viewers. Definitely a lot going on here, rapidly evolving multimedia radio broadcast. We heard from Dr. Hoa Wen, the 15 positive cases. Of course, one of them is a officer at DOC, and then the other 14, according to Dr. Wen, are not connected to the airmen who disobeyed their supervisors, their superiors' direct orders. These are, according to what Dr. Wen said, scattered throughout the island. So
he also said the National Guard was going to help with the contact tracing.
Yeah, so public health definitely has their hands full as their director is retiring. They were conducting the contact trace investigation with this whole airman thing. And then now with these 15 new positives, they're going to have to go in and investigate who these guys had contact with. And it's just really snowballing so fast for me. And we also spoke with Dr. Wen, and basically he said, as of now, the 5-day rolling average, we're on the borderline of meeting that criteria that would then roll us back. So, guys, cross your fingers, knock on wood to see what kind of results we're going to get today.
Yeah, wait, he also said he thinks we're going to be going into PCOR 3?
Yeah, I'm so confused. I'm not confused, but there's some confusion in the government of Guam, it seems like.
Why?
Because, well, we've had like one part where he's saying, oh, we got to be careful because there's 14 cases scattered throughout the island, not connected to the airmen, not a cluster, which to me, I mean, it was a cluster. We've seen them explain away 11 positives by saying, oh, it's all in one house, we don't got to worry about it. So I'm curious, how do you, and I don't mean explain away, but I feel like 15 positives, that's something to be alarmed about. It is. And so when Dr. Wen comes on and says, oh, no, we're still going to go to PCOR 3 or the rolling average, we didn't meet that criteria yet, there's only one hospitalization. I just have to wonder, why do we set these criteria and then totally ignore them?
I think what's also important is that we can't let our guard down because it appears that we may have, and we just need to continue practicing social distancing.
Right.
Wear your masks, wash your hands,
Correct.
practice good hygiene.
Yes. Stay home if you
don't need to go out.
I've been staying home. I've been staying home. So when that whole list of 30 businesses, I was like, oh, I don't even need to look at that because I've been staying home.
The other thing that Dr. Wen mentioned was the Physicians Advisory Group. They had their meeting last night. They discussed the possibility, which is not going to happen anytime soon,
Right.
Of testing out of home quarantine. That would be paid for by, obviously, the person that's in home quarantine. That cost you would have to bear that. And he's saying that they still need to work on all the details for that. And the likelihood of it maybe going into effect would probably be sometime in August. He also mentioned that they're planning to test the arrivals that are at the government quarantine facilities, possibly this weekend, because if you've been following what we've been reporting and the situation reports that are coming out of the Department of Public Health, we recently seen arrivals from the Philippines, and so some of them have tested positive.
Right, 2 according to Dr. Wen.
Right.
8:26. Let's just go to the phones and get the hospital administrator Lillian Posadas on to the show. Good morning, Lillian.
Good morning.
Good morning, Chris. Good morning, Sabrina. Good morning, Guam.
I guess we'll just first start with Dr. Wen telling us that there's a COVID hospitalization. What can you tell us about that?
We do have one individual came in yesterday, sometime late morning, and from one of the clinics in the community, and so he is COVID positive, and so therefore is in our facility in the Care 3 COVID unit.
Can you tell us the condition of the patient?
He's stable. He came in manifesting some respiratory symptoms, and so, he needed to be hospitalized. He needed the medical treatment, so he is stable in the COVID care unit.
Mm-hmm. How old?
He's in his 60s.
And is that kind of why he checked in? Are you guys just taking extra precaution because he's elderly?
No, well, he was manifesting respiratory symptoms from the clinic. So he was transferred over from the clinic because of the respiratory symptoms that he was manifesting.
Can you tell us anything about how he contracted COVID?
No, we don't know. I don't have that information.
Right,
How? I haven't been able to get a briefing, more detailed briefing, other than he was transferred over from the private clinic yesterday, and so we've admitted him. That's all I have for now, Chris.
Right.
If I get more information, I can update you without disclosing too much of protected health information.
Of course. Well, appreciate that, Lillian. Another thing I can appreciate is the last couple of times we've had you on, you kind of ended our conversation with this reiteration about how serious we should all be taking this COVID-19 pandemic. And I remember we had brought you on, and I think it was when we were first starting to reopen things, and you had really made a plea to people that you were, worried that we're gonna do things recklessly when we reopen, and now we're looking at this surge and this spike. So, what do you have to say about that?
Well, again, I plea to the community: please take heed and be very conscientious about it, and protect yourself, protect the community. We need to make sure that we don't see all the spikes as it is, predicted or anticipated. Let's not let it happen. But it takes the collective committed work of everybody in the community.
Did you want to ask? I wanted to ask about the Department of the Interior. They just awarded the grant, the $367,000 to GMH to train nursing and revenue cycle management staff. Can you explain what is that? Revenue cycle.
You say psycho management?
Cycle management.
What does that mean?
Are they psycho or what? How psycho are they?
Well, what that revenue cycle management is, it's a process, a program, procedure for our medical billing section of the hospital, looking at the medical records and making sure that, what services we provide are well documented in the patient's health record, so that it all gets translated, codified, and translated to then reimbursement for the hospital from the payers, such as the insurance, with minimizing making sure they're accurate, they're complete, and minimizing any disputes from the insurance because we don't have the documentation, we don't have the notation from the doctors or from the services departments such as radiology, respiratory, lab, pharmacy. They're not accurately and completely documented that we administered or we provided those services while the individual is in the hospital. And so we're just making sure that all of that is in there completely and accurately so that when we submit the claims, the bills to the insurance, they will pay us. And we complete that in a timely manner so that, the payers will not dispute, well, you've gone over the 90-day, cap. You did not submit your bills in the 90-day period and accurately, so therefore we're not going to pay for this claim. So that's what that revenue cycle management is. The grant, we're going to do more training. We've recruited more coders, but we want to make sure that they're trained properly and following the regulations for, making these bills and these claims as accurate and as complete as possible.
Right.
In a nutshell, that's what it is.
Okay.
Does it make sense?
No, not really. No, I'm joking. It does. It does.
I was going to say, does it make sense? Okay, how else can I make it?
No. It does. I wanted to follow up on what we talked about last time. Gosh, it's been a while. About the Army Corps of Engineers report and how GMH was weighing whether or not it would be more economically and financially feasible to build a new hospital versus making all these renovations that were indicated was needed in that Army Corps of Engineer report. And I know that the plan was, what you guys are seriously looking at, and what the governor has already indicated was building a new hospital, right? So has there been any further discussion on that?
Okay, well, first of all, the Army Corps of Engineers, in their assessment, they recommended two options, and that's the repair and replacement and everything, all the deficiencies that we have. And in comparison to building a new hospital, the cost of building a new hospital is a little bit less than really going through the full gamut of repairing this hospital to meet all the code and the regulations. It was something like $700 some million, and the building of a new hospital was a little bit less, but it was still $700 some million. So, if we're going to invest $700 some million to do all these repairs and the fixes, why not just build a new hospital? And so that's the decision that, we're going. That's the direction that we're going. And so we have a task force team put together to, make sure that that goes forward. The board also, that was the recommendation of our board of trustees, is to have, a task force to look at that. And also from the governor's office. So we're kind of on the same page in terms of it. We need to build a new hospital. There's just no question about it. In the meantime, we still need to make these repairs and the fixes. Like the HVAC, the leaking roof, the envelope of the hospital, the walls and the windows. We need to get those fixed because if building a new hospital is going to take probably 5 to 7 years, is what the experts, the engineers tell me. We need to continue the operations, and so we need to make sure that we don't have any more leakages, that the air conditioning, the heating, ventilation in all the patient care units are, up to standard, because some of these units are old and they need to be replaced. And so we still need to continue those repairs and those fixes while we're waiting for the new hospital to get constructed and get completed so we can move into it. The discussions have been ongoing in between all this COVID situation. We continue to have the dialogue and the discussions that we want to move forward with building the new hospital. The bill that the Senate and the Congress in the U.S. How much $1 trillion and that Guam may possibly get billion, 30 billion? Is it 30 billion? I can't remember anymore the number, the figure. If we get that, boy, that would be a tremendous source of, funding for the new hospital. So, but we're just now waiting for the U.S. Senate to take action on that one. But yes, the dialogue, the discussions are ongoing.
Okay. Is it too early to say what property is being eyed or location?
Well, again, from my perspective, the Manila property or somewhere in Manila where it's close to the University of Guam, so it's affiliated with an academic institution, and research is another issue there that I also strongly advocate for and support research for the island. And plus that it is closer proximity for the people of the South.
Amen.
That's just my own recommendation. But I think the governor has mentioned looking in the Barragata area. But there have been some other schools of thought from other, I guess, officials they're thinking. But I haven't gotten really anything other than what the governor has shared with us at one of the meetings.
Well, that's interesting. If it were to be located, I think next to UOG.
Right, and then you would be able to just so easily fold in the nursing school there and
program. Yeah, absolutely. There's social work.
Right,
there's all kinds of academic programs that the students going through those programs can then be can have the experience, the clinical experience if it's in a hospital, research opportunities, and I advocate for research because our population, the demographics of our population is different from the demographics of the people in the U.S. that studies are done. Many studies are done even through Europe, but let's have some research studies done on the demographics of our people. Once that, especially if it's a medical research, we can at least have some better idea how we can then tailor the medical treatment that fits the population of our island.
Right.
You know what? One thing, I think it was pre-COVID. It was definitely pre-COVID. I was watching video of one of the board meetings, and I believe there was something that you had mentioned about, I don't know if it was a grant or something through the Department of Labor to help, I guess, not necessarily recruit, but to build
our resources.
Yeah. Do you remember that? Well, you probably do. Of course you do. Can you give us an update on that?
We haven't moved forward with that, but in our conversations with the representative at the Department of Labor, they received quite a bit, a large amount of money, I think in the millions, for programs such as an apprenticeship program.
That's it.
Right. So what we were looking at, UOG and I think GRMC embarked on a program to then for a nurses' aides program. And so they started that over there, and we were looking to replicate that here at GMH, but COVID hit us, and so we had to put that aside. But it's still an opportunity. And I believe the funding is still there. It's still an opportunity for individuals who, if they're interested, if they have that desire to be in the track of a health career, the starting point can be a nursing assistant. And then hopefully that their desire continues to blossom and they want to become registered nurses or, in another discipline in the health profession. Because, health profession, we need them. We really need professionals in our healthcare industry. And so, we're going to try and revisit that once we can get off this COVID or put some time aside and energy. And also the Department of Labor, with this recent COVID, they've got some funding to then hire those who have been displaced from their jobs. And so, we're looking to see how we can take advantage of that resource, that funding resource, to hire or train people in the hospital.
Yeah, I only brought that up because we definitely, like you said, we need more people in the healthcare profession right now.
Yeah.
And we have our people on island that, are have the talent, and, we just need to kind of help them get on that track.
We just, all the graduates.
Right. Well, and, and help get people off this track that, they feel helpless, they can't get a job. They can. We just need to kind of help nurture them and support them that, don't feel helpless and hopeless. There are opportunities.
All right. Is there anything else going on over at GMH?
Well, we had the budget hearing yesterday,
Right.
so I think that went well. We're trying to live within our means, and so we're trying to also do our part to generate the revenues to sustain our operations.
You're not planning on retiring anytime
Yeah, are you
soon,
retiring?
are you?
I am a retired government employee, so no, it's tempting. I'm 65 years old, and I'd like to enjoy life a little bit more with some time because my husband is retired. But no, we're here. We have issues to deal with, and so God willing, as long as God is allowing me to wake up and my brain functioning, I'm here for a while unless. The Board of Trustees says, Lillian, we're not happy with you. We're going to get somebody else.
Right.
Just make sure you're taking your me time.
Yeah.
Yeah,
Don't stress. As much. I know you're going to stress, but
I still have my license as a nurse. I can still work, so
All right.
go back down to the front line.
There's an opening at the airport.
I can still take blood pressure, and I insert IVs and insert that NG tube. So.
There's an opening at the library. Do you have a master's in library science?
No, sorry.
Neither did the last lady, so no worries.
Oh.
All
right, Lillian.
All right, thank you.
Thank you so much.
Stay
God
safe.
bless you. Wash your hands.
Stay safe, and wear your mask, practice social distancing, wash your hands.
Amen.
Thank you.
All right.
Have a good weekend.
You too. Bye-bye.
Okay, bye. Good morning. It's 8:40. Let's keep it going on the phones here. He had wrote a letter to Speaker Tina Munia Barnes.
Yeah.
Yeah, I'm looking at you because I didn't.
No. So,
Yeah.
so the speaker, remember we had her on the air.
Yes.
I think it was Monday. She was doing her report, and then it just happened that over the weekend we saw that jump of 22 Air Force service members that are deployed here testing positive for COVID-19, and it was apparent that they violated their orders for restricted movement, and so she had requested the Attorney General to look into the quarantine laws that are on Guam and see where it can be enforced. And so the AG's office started conducting their investigations.
All right, and so let's bring on Attorney General Levin Camacho to talk a little bit more about this. Good morning, AG.
Good morning, Chris. Good morning, Sabrina.
Good morning.
We'll just go ahead and give you the floor. Just give the status, if you could.
Well, Chris, I think when we got Speaker's letter, we've been monitoring the situation, and I think we all agree that one of the basic premises of our law is that everyone needs to be treated fairly and equally. So we've been monitoring the situation, and it seemed as though when the Department of Defense said that they would kind of handle things on their own, that some people thought, okay, we'll just let them go that route. And that's just not acceptable for our office, especially when we have laws that make it a misdemeanor to violate quarantine orders. So we started our investigation. I know Speaker was concerned because we've been complying with these quarantine orders for months now, and it is a misdemeanor under our law to violate quarantine orders. So the first thing we did is we pulled up the public health guidance on travelers inbound to Guam, and everyone is required to fill out a form. Residents are able to quarantine at home now. That was a recent change. But if you're not a resident, they have essential worker exceptions for medical workers, airline passenger or airline employees, and then you get down to the active duty military, and that was the only provision that limited the quarantine orders and signing it to if you arrive to Guam via commercial air or sea. So that brings up, we have basically a different treatment if you arrive to Guam at the Guam International Airport versus if you arrive to Guam at Anderson. So that's we're still at the fact-finding stage of our investigation, but that's what we've been able to learn. We've been in contact with public health, but our position is that yes, the military has their own rules and regulations, but no other employer would we ever say if they brought in 120 people and 10 or 12 of them were out violating the quarantine orders, it's okay, you guys can handle it, we're good, right? So just the impression that it does seem as though it's not fair.
So your investigators, your office, you guys have had direct contact with the military?
We've been working with public health, and I think you guys ran a story basically saying that they're not even getting direct access to the service members. So I think our community has some very valid questions. What orders did they sign? I know they said that they violated these restrictions on movement orders, but were they required to sign our forms? Were they not required to sign our forms? If they didn't sign our forms, what forms did they sign? What measures were taken to make sure that they were complying with any orders if they were staying off base? How early did they know that there were these problems? So, there's just a lot of questions that we're hoping to get answers to, and there's a chance we won't, but we're going to try. We're going to try our best to figure out what happened in this case.
Mm-hmm.
Do you think this is good, like a good litmus test to find out exactly how much authority your office has to ask the military these questions?
Well, they say they're going to be cooperative, but again, I just think it comes down to, okay, don't worry, we're going to handle it on our own, and we do have our own laws. So no other crime if you could commit, that you would be able to just move someone onto base and say we're going to avoid local prosecution. There would be some serious problems with that. So we don't know if any crimes were committed here. A lot of it's going to turn on what evidence we're able to get. As I mentioned, it's a violation of public health orders, but we don't even know at this point whether or not they were required to sign public health orders.
Right.
Because they may have come in through Anderson.
That's correct.
Do you know where they came from at all?
We're trying to get a solid answer before I can give you. I can answer that, but it's every day the information is changing. I'll tell you, Sabrina.
Do you know how many?
We know that the general number of those who came in was around 130.
Right. Yeah.
And I know there were 35 or 35 positives for this group in particular, but what we don't know is how many of them violated the restrictive, the quote unquote orders, right?
Mm-hmm.
Was it, one or two people? Okay, that may just be real poor decision making on the part of those folks. But if we're talking 10 or 20, then there's a serious breakdown in what exactly are we doing to make sure they're complying with these orders. And
right.
The only way that we're going to be assured moving forward that this isn't going to happen again is we need to be very transparent about the measures we're taking now in response to this. So if there was a gap for those arriving through Naval Base Guam directly or flying in through Anderson, we need to know what those measures are going to be.
Right. Mm-hmm. I mean, 30 different locations. It's hard to imagine just one or two people going. I mean, they racked up some miles, unless these were like the Gophers.
Mm-hmm. Well, Chris, and it goes back to those are very basic questions. And
right.
I don't think that the compromises national security or HIPAA. Just tell us how many are we talking about that violated these orders? Because, and I'll tell you on the flip side of this, we've been working with public health, and it's not just a service member problem. We have locals who are supposed to come home and quarantine at home that are violating.
Right. Yeah.
And we've been having discussions about what we're going to do, and public health has been focusing on education, telling them you need to comply. Look at our numbers today, that there's probably some of it's going to be connected to travel.
Right.
But how can we in good faith arrest someone locally when we know that there are folks who are infected and violated quarantine orders that we're supposed to be following, and we didn't do anything in that case? So we're going to exhaust all efforts on our end to make sure that we figure out what happened. If we can pursue action, we're going to take it. And if not, then we're going to make sure that if it happens in the future, we can.
Right. Have you had any conversation with the Air Force JAG?
Again, because we've been working with public health primarily, is just trying to figure out on our side what the protocol is and what the procedures are. And we just started on Monday. Okay. So we know that they're in talks with the Air Force, and we're trying to figure out what we can get from our local government first, and then we can make those calls to the Air Force.
I'm reading your letter, and it says DPHSS is also supposed to be notified by DOD when arriving service members are staying off base, right? And I want to see if you're aware, did the Theodore Roosevelt sailors also, obviously they were notified, but did they have to sign these papers that you were referring to earlier?
I don't know what they were required to sign. Mm-hmm. But I know that our office's position has been, if the only way that we can enforce these types of our laws is if they sign, or it makes it much cleaner for us to enforce our orders if these documents are signed. So we can go back and we can see what the process was when they did that. But that's always been our position from the very beginning, that these documents should be signed by all travelers.
Right, when they arrive to Guam.
Correct.
Does that apply if you're arriving by sea?
It applies to everyone except for if you're not coming in, if you're flying commercial or arriving by boat commercial. So that's a wrinkle here that I think I'm pretty confident is going to be resolved moving forward. Yeah.
That's.
So to answer your question directly, Sabrina, it doesn't appear as though if you arrived directly on Naval Base Guam through a boat, you were required to sign any public health forms.
You're not required. It's not clear whether you're.
It doesn't look like that based on the guidance.
Oh, okay. It just seems like, when the Theodore Roosevelt sailors came in, there was this, it's like they had to get approval to come off base, right? And then all these restrictions, or not even restrictions. Well, yeah, all these restrictions were in place where they could go, where they could not go. And we were part of the military monitored that. But it just seems like with the Air Force, they came in, they quarantined at the reef, and I don't know, where else. And there was no monitoring of these guys.
There was no communication, it sounds like, right? Or monitoring.
Yeah.
And I will say public health has just been, they are having, some of our investigators are assisting in the quarantine checks. And they are monitoring a lot of people right now at home. And that's one of the things that when we moved from quarantining at facilities, government facilities, to allowing for quarantine at home, it just puts a big stress on public health to go out and to make sure that folks are following what they're agreeing to. So, I could see, depending on the numbers, but you're right, and this is what happens when there's a breakdown potentially.
Yeah.
We lose track,
and we have service members out gallivanting.
Yeah.
Okay, so what's next?
So we're still continuing our investigation. We're going to find out. Those are the questions that we're looking at, figuring out, how many people did violate these orders, what the orders were, what type of measures were put in place to ensure compliance. And we'll be sharing that with Speaker. She's been very supportive of us in doing this because she's concerned, and she's rightfully pointed out again that any other employer would have been, just completely taken to task if this had happened under their watch.
Right.
At what
we
point?
just want to make sure we can treat everyone fairly.
At what point does it go from asking the military for certain information to demanding the military
and
provide?
asserting that authority?
We'll see when we get there, Sabrina and Chris.
We want to see the We Are Guahan leaving out here. Like, hey, I want to see you jump the fence and
Well, hopefully, and we all joking aside, Chris, and you mentioned that, and this whole, I don't know, it's been over 10 years or so. It feels like it's been an eternity, but this whole one Guam, good neighbors, right? And then this thing happens, and it's just, you just can't put your blind trust that people are going to comply, and just, okay, you're the military, don't worry, you're going to do good. And I think that's just part of what, as a community, we're struggling with. It does seem like they're getting a pass here. That okay, don't worry, they're going to handle it on their side, right? It's like once you set foot off the base, you put our people at risk. Those 30 establishments, the person who tested positive at the Guam Reef Hotel, that's not just the military and their mission, and that's their main concern is their mission. But we represent, our office represents the people of Guam, and we can't in good faith go out and arrest our locals and bring down the wrath of God on local businesses and then give certain people a pass because for whatever reason. So yeah.
I wanted to, before we let you go, the Department of the Interior, the AG's office, they received part of this technical assistance grant for financial forensics training.
Yes.
Yeah, can you speak a little bit about that?
I can tell you that we got the award, and we're looking at the grant documents. I'm proud of our grants team, and I know that we have, just from our financial perspective, just getting our internal compliance measures lined up, but it's not particularly sexy stuff right now. So, yeah.
All right. Financial forensics.
Financial forensics.
Controls, but it's not yeah.
Okay.
I had one, AG, is there was a CARES Act funds available for daycares with the any PPEs and all that stuff, and so Public Health had said they sent it over to you guys for review, and then Carlina had said you did some review and assistance. So specifically on the CARES Act funds that Public Health is going to be disbursing for the daycare and the child care centers, what was the involvement with your office, and have you completed that so we can tell the daycares who've been kind of waiting where we're at right now?
Chris, so that during this whole public health emergency, we've kind of recognized, and we've done things a little bit differently and been more proactive in offering our assistance to our agency clients. And this is an example where I can tell you right now, there's no document on my desk just waiting for my signature before it gets out and these child care centers are going to be given their grants. Our office at this point is basically offering grant assistance and technical assistance and guidance to public health to make sure they're going to comply with all the requirements that they need to put in place and procedures they need to put in place to implement their program. So public health rightfully wants to make sure they're going to spend that money in accordance with their grant conditions and the CARES Act law, but we're not at a stage where there's a document that's just waiting for my review.
Okay. And so just in English, if you
we're going back and forth, and we're helping them to develop their program, and once they get that finalized, then it'll come to our office for final review, and that'll be, I know that this is a big deal. We're, as a family, I have a young son that we're waiting for him to go back to childcare, and it's just, I think that's another one of those things where as parents, you're coming into work. We're going to be opening up more potentially. I just saw that we might be slowing it down, but it's very difficult to expect anyone to go back to work 100% and then not have anywhere to put your kids.
Right.
So we recognize how important it is for everyone, whether you're an essential worker, whether you've been working throughout this time, to get that money out. But we're not the holdup, I can tell you, Chris, I guess, in layperson's terms.
Okay. Last question. The Tier 2 clinics, we had spoke with Dr. Hoa and a few of these clinics, and at least on Dr. Hoa's side, he had said that there was some stuff at your office for review relative to payments to these Tier 2 clinics. Can you just, we haven't heard anything, so whatever you can offer is good.
I'm not, I know there were some discussions, Chris, but I think you're seeing a trend here that normally if there's a way to get you off the phone, it's to say it's with the AG's office. So, because as much they just hope that they can say that I don't call into your show, but I'm not familiar with that.
Okay.
All right. Well, thanks. That's it. You good, Bree?
Yeah, I can't remember anything right now. I'm.
Yeah, I know. I mean, and I think you're in the same place a lot of people are at. It's just we just don't. How can we get to a place where we don't have very basic questions answered?
Right.
Mm-hmm.
Right. Yeah.
And I wish I could tell you more. And we're just trying to piece through it right now too.
Right.
And once we can give those answers, we will. But I share your kind of like, how did this happen?
Yeah.
And I can assure you that we are doing everything that we can. And yeah.
Okay.
Thanks, AG.
Yeah, wash your hands.
All right.
Be
Thank
safe.
you, you too.
Okay. Yeah, so maybe we'll get him on next week to kind of catch up on what's going on with that. Yeah, very interesting. Very interesting. 857. It kind of sounds like, in terms of this investigation into these airmen who willfully violated their superiors' orders and jeopardized the public health of the people of Guam, it kind of sounds like he's still in the discovery phase, like going through what public health orders are. I think that's pretty interesting stuff, though. He's right. When all inbound travelers into Guam are required to adhere to all these different public health measures, like you said, filling out the form. But this really just, to me, highlights that there isn't one Guam. There's one. I mean, we just don't. And my phone's blown up. Like, we don't have the authority to do that. They're immune, and I guess we'll see where this investigation goes. 857. I wanted to bring on Sergeant Paul Tapau from the Guam Police Department, because there has been, man, you guys, you guys, this return to new normal, I didn't know it was going to include, resuming all of our knucklehead crime. You know what I mean? I feel like when we were on lockdown, these guys got a well-deserved, I'm not saying they weren't working during the lockdown, but, for the most part, everyone was locked down, right, Sarge? And now it's like, man, feel for you guys. I don't know if it's people are just pent up and then out here, but we've had a shooting death,
the crash, the hit and run, at the precinct.
Pretty crazy. So, how are you doing, Sarge?
I'm doing well. Thank you for asking.
You sound a little hesitant there. You all right?
Yeah, no, I'm actually going over some of my emails and everything for the closing of the week. But nonetheless, you guys were pretty much spot on. It was a busy week for the Guam Police Department. Every precinct in general was pretty much, swamped with or inundated with some of the workload that was associated with, daily crimes and, of course, the out of the ordinary crimes that, we had to attend to. But, nonetheless, the officers that were involved in the crash, they're recovering. That's good news. They were treated on scene. That's an active investigation. We're still moving forward with that. And, our piece with that death investigation on Tuesday in Agana Heights, and, the magic reports came out. The officer of the Attorney General had additional charges of murder. So, we're still going to continue to tie up loose ends on that. That case still remains open on our side, but it's been an interesting week for us at the Guam Police Department.
I know that in the Ordot crash, right, the by the precinct or at the precinct, there was a person of interest.
Yes.
So you guys have not been able to find this person of interest?
We are actively pursuing this individual, and as the day progresses, by close of business, I should be releasing more information.
Okay.
I'm going to reach out to our highway patrol investigators, and I'm also going to be reaching out to our CID investigators. So, like I mentioned before the close of business today, I should be putting out some more information to see where we are in the investigation, and of course to keep the community abreast of what had happened. And the good note is, our officers are recovering, so that's a good thing. That's a good sign for us.
And just for people who are listening and aren't aware, so there's two investigations. There's the hit and run crash investigation, and then there's the aggravated assault investigation.
Yes, aggravated assault and assault on the police officer complaint has been generated. So, there are some issues that were brought up, some precursors, events that were attributed to this. So once we piecemeal everything together into the investigation, and of course preparing the release, we should be putting something out, like I mentioned, before close of business today.
Right. Okay. Sarge, what would you say to those people who look at this, hit and run at the precinct, and they see that, we got one investigation for this, one investigation for that, and maybe those people out there who've had a crime committed against them aren't satisfied with the amount of attention their case is getting. And here we have a case where someone crashes into a cop car, and I'm pretty sure you understand the optics of it. It's like we're pulling out all the stops, right? Yeah.
Absolutely. So just to be clear, to the general public, we at the Guam Police Department, in any investigatory agency, especially with where we are with entertaining complaints and what have you, we look at the full totality of the circumstances. So here you have, if you consider this like a chain event, one, we have our precursor as to why the vehicle was there, the purpose. Then we have the, it caused a reaction into the officers, and of course the crash in itself. So, these are the full totality of the circumstances in which we need to look at, or every officer, every investigating officer looks at while entertaining a complaint or a criminal investigation. So, there's things that can lead into, one thing leads to another. So these are things that we have to piecemeal and put together to form an investigation or to formulate a complaint. So I know the optics, as we're focusing a lot of attention, but there's circumstances that surrounds this particular investigation. It's very unique. In my time in the Guam Police Department, this is very, I want to say this is one of my first encounters with this type of incident where, I can rightfully say that the intent was really, from my perspective, is to cause harm to, bodily harm to another individual.
Right.
And that those individuals are a police officer. So, there are things in which we have to look at, and again, we're looking at the full totality of the circumstances.
Would there be an investigation, because, I don't even know what the circumstances are that would provoke this individual to allegedly go after these police officers.
Right.
Is there any investigation into the police officers in terms of like what may have? Yeah.
Was this someone who was like in the precinct, maybe booked a release or anything like that?
We do know that there was a complaint that was that was going to be formulated into there was a complainant that was going to formulate an official complaint, and as I mentioned, we're going to be putting more stuff forward. So one thing led to another with this complaint. So we are moving towards that initial complaint, which led to the crash with the officers, and of course to the hit and run crash, not just with the police officers, but outside in the main thoroughfare in Route 4. So we do know that to put everything together, there was a complainant that was going to initiate a complaint at the precinct at that time. So
did the POI file that complaint, or the intention was for him to go there to file the complaint? Was it filed?
These are the things in which we need to, I have, again, to protect the integrity of the investigation. We are going to look at the preliminary initial complaint that as to the complainant, why they were there at the precinct to file a complaint. There are a slew of things in which we need to look into. So from there, we can piecemeal everything as to what transpired with the interaction with the officers that were in the vehicle, and of course with the crash that occurred on the main thoroughfare in Route 4. So we've identified a complainant and a complaint that was going to be generated that day of prior to the incident. So we'll put more out. So
can you say if the complainant that was going to file the complaint, it was the driver?
No, it was not.
Related to the driver.
There was some sort of relations between the complainant and the operator that that was operating that vehicle at the time of the incident.
Mm-hmm. Okay.
So, yeah. So these are things. Again, this is where the optics.
Mm-hmm.
We look at the full totality as to what happened. So there's always a cause and a reaction.
Yep.
There's always that chain event that we have to say. We have to look beyond that. That. There's a lot of science that goes into it, and Chris, you're right. The optics is we're focusing too much attention here, but like every investigation, we look at the full totality of the circumstances that led to all these events.
Well, you mentioned that there was a relationship or some sort of a connection between the complainant and the person that was driving the vehicle. Was there any sort of connection or relationship with this complainant to any of the police officers?
That one, I don't think so. I think it's just more or less as the complainant itself and, of course, the operator of the vehicle.
Mm-hmm.
So, yeah. So,
So the only connection between the complainant and the officers is that the complainant had a complaint?
The complainant, yes.
Okay.
Yeah, so we have a complainant that was going to initiate, a victim that was going to initiate a complaint,
against,
of course,
the officers?
The operator. No, not the officer. The
Okay.
operator. So, yeah, we'll provide more.
Is it like a domestics thing, Sarge?
It's from what I gather, we have to, we're looking into that avenue, and nothing official until I put an official release that's of course vetted to, of course, all the investigatory aspects of this case. The Highway Patrol, the prelim that was generated and authored, and of course, clearing so that we protect the full integrity of the investigation. Because there's multiple victims here. It's unfortunate that a family that was motoring on Route 4 was, they became circumstances of the event, and it was really, it could have been, being a crash investigator, there could have been some serious injuries, or could have led to fatality because of what had transpired. So, we are, like I mentioned, we are actively, pursuing this case. So. Hopefully we can bring closure to this by, within a time frame, hopefully by close of business today.
Right. Sarge, there's also a few cases that you guys can't move forward on because you're waiting for autopsies, right?
Yes. We do have, we are still that case, and I just want to bring to light that, that case with the death investigation that we reported earlier in June on Route 1 Route 1 to Mooning by Waizao. That's still an open case. That's still an open death investigation. And the only thing pending on that, of course, is the autopsy. And we also have this death investigation, which occurred on Tuesday. The AGs had laid charges and moved forward with their charges in conjunction with what our officers or detectives laid during the time of the investigation. Of course, our classification is still status quo. Once we complete an autopsy and a pathologist determines the cause and the manner of the death, then we will move forward and reclassify the investigation. So many aspects come into play. It really, an autopsy is really critical too for where we are in understanding, the manner and the cause. What caused the death is really important, in the manner of how it was. How the victim had succumbed to the injuries.
Right.
For the Tamuning death, was there any indication? I mean, I know you can't say officially because you have to wait for the autopsy, but is there any indication that the individual that passed away in the Tamuning incident
was beaten to death?
Right.
See, again, here's the full totality of everything. Initially, when we got the call, Highway Patrol got activated for an auto pedestrian crash. So these are things in which we need to determine and so forth. So, when we actually moved into the death investigation, we had crash investigators and our CID, include our crime scene investigators at the scene. So this is where the autopsy comes into play.
Did you say autoped?
So it could have been a hit and run, or it could have been that there was an altercation, or we don't know.
So that was the initial cause, and hence the classification of a death investigation. So, it's really, the autopsy in itself will paint that picture of what we need to move forward with the investigation.
Sarge, I mean, this not having the forensic pathologist, dealing with that shortage in the medical examiner's office, I got to ask, are people getting away with murder because of that?
It's really, when we had, this is, again, pre-COVID, and everything, the arrangements were made, in assuring that an autopsy was performed. We had a CME from Saipan coming over to do cases that were able to assist our crash investigators, and of course able to determine whether it was natural causes or self-inflicted. And of course, any criminal aspect in which we felt that we needed more science to it, we would recruit, or we would actually ask to bring in a pathologist that will be able to testify in court based on the scientific findings. So arrangements were made to fly in the pathologist, and again, this is pre-COVID. Right. So now we're facing COVID, in which we have to assure the safety of the community. There are mandates that are set in place based on the public health executive order about quarantine and stuff. So it really becomes a challenge for to get a pathologist, whether it be from Saipan or from Hawaii, because you got to keep in mind that they have to cover their end of the shop too in their respective state or territory. So, I do know that there was works and talks with the former AG, Judge Barrett Anderson, and of course the current AG in working in since the retirement of Dr. Spinola in securing that, and it's really that challenge of interest where. Sparking an interest from a chief medical or a pathologist that is willing to, live and of course work on this beautiful territory we call home. So these are some of the things, but
So people are getting away with murder.
No, not necessarily. It's really once we lay down the once we get the pathologist and we do an autopsy, it really the investigation in itself is kept open for this purpose, and this, once we bring closure, once we get all the information that's needed for prosecution, working hand in hand with the Office of the Attorney General, this is again in which the officers or the detectives working the case or the crash investigator, we move at getting a conviction. So, this is why we keep our cases open. This is why we go with the classification of a death investigation. Once we move forward with the autopsy and, of course, the findings, we can reclassify whether it be an auto pedestrian crash or vehicular homicide, or, the manner of death rules in itself as a homicide. So this is where we can actually lay the charges, and the charges that were laid by the prosecuting attorney will have grounds and sufficient grounds to lay that conviction.
Right. Okay, Sarge. Are you guys assisting with the cleanup tomorrow in any way?
We are providing security detail throughout the entire island, and again, in the effort to really spruce up the island, we ask, in the interest of safety, to please be cognizant of the volunteers that are going to be out there. I know my family, we are going to step it up, and we're going to actually help our village, with the cleanup just in our general area. So. You're going to see a whole slew of traffic out there, throughout the northern and the southern end of the island. So, people that are motoring to and from, please, just be cognizant of the traffic that's going to be there.
Right. Have you heard anything about a postponement, Sarge? Because we had Mayor Hoffman on. He's on the GVB board. He had said that there were going to be some meetings this morning, and he said it was a possibility.
No, we have our marching orders to provide the security details. So until anything changes, the acting police commander, alongside with the chief of police, they'll make the decision as to what we're going to do. But we still have our COVID operations that we tend to on a daily basis. So the Guam Police Department still continues to provide that service to the community. So.
All right. Well, thank you, Sarge.
Roger that.
Thanks.
You guys take care, stay safe, God bless, and enjoy this beautiful day that the Lord provided to us. So.
Right. Next week, let's talk about the Hells Angels on Guam. I keep forgetting.
We're all 1% off, so we'll keep it at that. But that's a great topic. But
yeah,
we'll chat more next week.
Yeah, you got it right.
I'll be talking to you later this afternoon about this press release, though.
All right, you guys take care.
Okay.
Thank you, Sarge. Wash your hands. Okay. 9:15. It's the KUAM News takeover of Guam's favorite. So, if you guys are trying to get a driver's license, a real ID, they're open this Saturday.
Yes.
From 7 a.m. to 4 p.m. Man, the line, Bree, was crazy.
On last Saturday?
Oh, my goodness. Yeah. I was getting a lot of messages, people complaining.
Yeah, they're having, it's open on Saturday, and actually every Saturday through, I believe, August, 7 a.m. to 4 p.m. But keep in mind, I believe it's the first hour is from 7 to 8 is for senior citizens, veterans, and individuals with disabilities, and then after 8, everybody else can come in.
Okay, so 8 to 4. If you guys need to get a real ID or a Guam driver's license, again,
renew a driver's license.
Oh, renew it. Okay.
No, apply or renew. Sorry.
Okay. Again, the show proudly brought to you by Ambrose Inc., Calvo Enterprises, ITN Coast 360, and the Bank of Guam. We'll take a short break and come back with more Containing COVID next at 9:16. And remember, 9:30. Oh, man, I forgot to tease this after the opening of the show. The DOE Gate Theater program had done a great performance of one of my favorites. I'm not really a musical guy. I know. Virgo, you probably think musicals all day, but not. So they did Little Shop of Horrors. But obviously with the COVID, they weren't able to perform it. So we actually have the whole performance of it.
Not the whole performance, just like some of the performances that they put together.
So, yeah, not the whole performance, just like most of it. Is that better?
No. Some of the songs from the show.
Okay. We have some of the songs from the show.
And a special congratulations to the class of 2020 message.
Right, that's coming up at 9:30. Again, it's 9:17. Containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
We hope that you and your loved ones are safe and healthy during the COVID-19 pandemic. It has been a challenging time for all, but now, more than ever, our cancer patients and caregivers need us. Although we are apart, we stand united in the fight against cancer. The American Cancer Society Guam is excited to announce our first virtual Relay for Life. Join us on Saturday, June 27th at 6:30 p.m. on KUAM TV 8, as well as on I-94 FM and streaming on KUAM News digital platforms. Cancer does not stop, and neither can we. On June 27th, let's celebrate together and fight cancer. Visit relayforlife.org/GuamGU to find out how you can participate in the 2020 virtual Relay for Life Guam.
Be healthy. Be informed with ITD.
It's not always easy trying something new. Sometimes you have to help your loved ones along. Nana is so used to her weekly trips to the bank that going online can be a little scary for her. But her grandson knows that banking online is safer and easier. So he's teaching her how to get started using Bank of Guam's online banking videos. Teaching is one way to show our loved ones we care. Keep your family safe at home and show them how to bank online. Find easy-to-use online banking tutorials at bankofguam.com or on our Instagram and Facebook pages. Bank of Guam, member FDIC.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial
Oh, you doing the giraffe dance?
I'm doing that. Wow.
The Jason Salas giraffe dance?
That was, did that make it on our KUAM News Instagram?
I made it on my Instagram.
Yeah, I made it on mine too.
You day.
Hey, check out our Instagrams, guys. We had Jason Salas doing the giraffe dance.
And did a little bit of, what is it, twerking? A little twerking?
Twerking is...
It was a...
twerking is a butt thing. You do your butt.
Yeah, and he did. He was trying to back it up.
He did,
remember?
yeah. Yep.
I don't know if it was a twerking or like a
He kind of got in your space a little bit there with that twerkage.
Yeah, and that's his that's his signature move.
Yeah.
He always does that.
Jason has maybe fantasy isn't the right word, but he often thinks that he went into the wrong career. He has always wanted to be a professional twerker. I think
he's gonna come in here in 10, 9.
I think he should follow his dreams. I want to be that friend that tells him, man, Jay, go for it.
Yeah.
Go for it.
Do you, boo?
It's 9:23. I wanted to bring on Joe Soriano. Now, Joe is the owner of a Nenny daycare, and this is an issue that we just had asked the AG about. We know that CARES Act funding that was able to be used to assist some of these daycares and child care centers with, is it PPEs, Bree, and disinfecting?
Yeah.
Yeah. And so there's been a holdup, man. We've had the money since April, and the daycares which were closed and are now starting to reopen have taken a tremendous hit, like so many other small businesses. So we wanted to bring on Joe, and I know that this is something that's been kind of frustrating you, right, sir? Good morning.
Joe, are you there?
Joe, are you there? Joe, are you there, Joe? Okay. All right. Well, yeah, trust me, guys. Take my word for it. He's really frustrated. And what we had heard from the AG is it's out of his realm. It's gone back over to public health. And what I've been able to find out is they're trying to figure out the application process. So that's bad news. I mean, if you were anticipating getting any of this CARES Act funding within, like, let's say the next week or so, then you might not want to hold your breath. Joe, is that you?
Yeah.
Okay,
Hi, Joe.
morning. Yeah, so this is something you guys have been, not just you, obviously the whole daycare association following this. What did you make of that latest information out of Attorney General Levin Camacho?
Well, it's frustrating, but what can we do? The CARES Act is a very complicated act, and I guess we have to follow the rules of the game. What's important is that we expedite the process. Do multitasking in terms of if you're getting it reviewed by the AG's office, let's get it done. But simultaneously, bring out the application so we can start applying for it, and pending the final reviews and so forth. We're all in dire need of the fund. We are already ready to reopen July 1st for our center. I know that the other centers have already opened. They're receiving all the kids, the families, the parents are following all the protocol requirements required by public health and so forth, and they're doing well. It's important that we get back to our business of educating our children on Guam, and funding is a very important piece of our business because we've been waiting to we have bills to pay, like the rent, like mortgages, personnel, and so forth, and acquiring equipment necessary to prepare ourselves for the reopening for our center. And other centers that have already opened, they have to recoup what investments they have made so far and pay for those, the vendors and so forth.
Right.
It's important that what's important is that we expedite.
Yeah.
Get things done. Act swiftly. It's taking too long, I guess. I'm hearing that the fishery is getting their grant soon, and they'll probably get it before us because of whatever requirements are dictated by the CARES Act. I'm not so sure. I know public health is doing their best. They've done a fantastic job keeping us safe and spreading and keeping us from spreading the disease and so forth. I don't know. It's an important aspect for us to try to keep afloat, survive this pandemic and its aftermath.
Right, and
get back to the new norm if necessary. That the new norm is all these protocols that we have to comply with.
Yeah. And that's what this money would help you guys with. It's PPEs. I think there's also funds for sanitization. Right.
Yes,
but I mean, sir, you bring up a good point because, Lania, by the time we figure out how the hell to give away this money, you guys are going to already be sanitized and everything. You know what I mean? Because you're opening July 1st. Other child care centers have opened. And once again, because of this government inefficiency, we have you guys picking up the slack and paying for things that we have money for. The federal government is raining down all kinds of money. Money for this, money for that, money for this. But we just can't figure out how to give it away fast enough.
Well,
it's frustrating.
Put it this way, a lot of money is flowing into our island. We need that money to revitalize the economy. That money goes back in the pockets of the economy and the vendors, people spending. There's millions and millions of money in the island. It's a matter of us expediting and releasing those funds to the people, to the businesses that are in need of it, and so forth. And let's get the economy open. we should open all the businesses to all our residents before we even consider the tourism coming in, because if we don't clean up our act now, wow, it's going to get worse, and we don't want to go back to P1. We want to keep moving forward,
Right.
Understand what we're dealing with, follow all the protocols, and so forth. And our children right now need education. I mean, they are our future, and the centers providing all that services, the child care industry is ready and have been ready. We are a very highly regulated industry. The norm for us is sanitation, education, et cetera, et cetera, et cetera. And those are things that we already have in place even before the COVID-19. It's a normal process for all schools on the island in terms of child care industry and so forth.
Joe, are you currently in the, is it the Child Care Development Block Grant Program?
There are a few of us in it. We have about 10% of our children are under child care development. We cater to teachers and people working out there, even first responders, et cetera, et cetera. And yes, that has helped us in terms of those that have children under block grant or public assistance. But that's just a tip of the iceberg thing. So what's important is that I guess we open up our centers 100% capacity, get back to normal, get back to educating our children, and get back to making them flourish, making them succeed, making them happy, and ready for the big school, as they call it, the public school or private school.
Right. Well, that's why we wanted to bring you on, Joe. Thank you so much for your input, and we're going to keep you posted if there's any additional developments with these funds.
But let me close on this note. I would appreciate if public health can just expedite. We pray that they have all the process in place, application in place, and give us the application. Let us apply for it, approve it accordingly to the guidelines that they're following, and release those monies. I mean, $6.4 million is a lot of money. If they have to take away 20%, 30%, or 40% for the administration costs, fine. But give us something. It helps in the long run. Be it $500 per child, $700 per child, $1,000 per child. The issue is just get it up to us and let us deal with how we spend it and how we appropriate the funds to help our business survive this pandemic.
Thank you, Joe. I got your number. Well, I'm gonna try and get Linda or someone from Public Health. I know they have Elsa. I think was the lady we had talked to.
Elsa Perez has done a tremendous job.
Right.
Linda, I think, to me, has done an excellent job. I'm sad to hear that she's retiring.
Yeah.
But I applaud the public health officials and their staff for keeping us safe.
Okay. Thank you, Joe. It's very disheartening to find out that they've still got to figure out the application, then they got to send it back to the AG.
Oh, yes.
So, I mean, that's very frustrating.
That's the unfortunate aspect of it.
I thought that we were a lot closer to giving out that money.
We're still doing a volleyball game because
right.
of the applications and the guidelines. I said, oh, my God, I thought we're done already.
Right, yeah. Okay, Joe, we'll keep you posted. Yeah.
Thanks, Joe.
Wash your hands.
Yeah, same to you.
Okay, Esta.
And wear a mask.
Yeah, wear a mask. Stay home. 9:33. So let's go ahead and jump right in because Tomas Manglotnia just messaged me. Hey, I'm waiting for the theater, and they were able to breathe. They were able to do this. Can you tell us a little bit about this? What we're about to play?
Right. So the Gate Theater, they were preparing to do a production of Little Shop of Horrors, but obviously because of COVID, it had to be postponed, and so Ernest DeChoco, he's the director of the Little Shop of Horrors. They put together a tribute for the seniors that were involved in the production of Little Shop of Horrors, and a congratulatory class of 2020 message to them because, obviously it doesn't look like they're going to be able to continue on with it, at least at this moment. And he reached out to me and he asked, he wanted to feature these kids. And of course, they said, yeah, let's do it. And so we're going to watch the video and the performances by these students. This video was edited by Matua Salas and Tim Dominguez.
Half-a-day seniors, this is Mr. Ochoco, and I wanted to say congratulations on a job well done. You have survived high school. Yes, I remember when I graduated a few years ago from high school. That's right, and I got my diploma, and it got me to the next level of my life. It got me to my college degree. It got me to everything else, all of the different certifications. So, just know that even though you're not walking down the aisle, even though you're not, doing the whole shebang thing, it does not diminish your accomplishment. It does not diminish it, and you are appreciated, and it is recognized. We recognize you, and we love you, and we support you and applaud you. Yay! I cannot clap because I'm holding the phone. So, yay! Ooh, I sound like a robot. Anyway, God bless you on this next journey. You too will become awesome and fabulous. Like moi. And you will have so many adventures and so many new things to learn. So go out there and conquer the world, or give yourself to the world and share yourself with the whole world, all of your knowledge and all of your skills and all of your talents. Bring it out there and share it. Make the world a better place, because you can. You can do it. Anyway, we love you very much here at the Gate Theater. Mwah! God bless you and Godspeed. Bye.
Hi. Congratulations to the class of 20. Line!
Go class of 2020, you did it!
Zowie, powie, holy cowie, you made it, seniors. Congratulations. You never know what's gonna happen next, but go on and get it. But remember, don't feed the plants. Bye.
Congratulations, seniors.
Good job.
Congratulations to all the seniors out there. Thank you for all the time you've spent with the Little Shop family. And we just want to say we appreciate you a lot. And thank you for your hard work as well.
Congratulations to the class of 2020. We are so proud of you guys. You guys deserve it. We wish you the best of luck and stay safe.
Hey seniors, congratulations on completing high school. We know this year isn't what you guys expected, but know that your Little Shop family loves you very much, and that we wish you all the best in your future endeavors. We love you guys.
Hey seniors, just wanted to say congratulations to completing high school. Always remember to follow your ambitions, do great things, don't get into any trouble, and yeah, may you stay safe in your journey of becoming full-on adults out there in the real world. Bye!
Hi seniors, we just wanted to let you know that we were thinking of you during this time.
We would also like to congratulate you on a job well done. We miss you.
We are proud of you.
And we love you.
Congratulations, seniors, on a job well done.
Congratulations, seniors.
We're so proud of you.
Hey seniors, just wanted to congratulate you on completing your senior year, even though it was pretty crazy. We are all wishing you the best of luck and hope for the best for all of you. Bye.
Congratulations and a job well done to our high school seniors. Thank you guys for the great memories. We wish you all the best in your future endeavors. Bye. We love you.
Hey seniors, just want to say a quick congratulations and a great job well done on your senior year. You've made it, you're alive, you're well, you're loved, and friendly reminder, don't feed the plants. Okay, bye.
Congratulations, class of 2020 seniors. You guys have come a very long way. Just remember where you came from and always be true to yourself. I wish you the best of luck in your future endeavors, and remember, don't feed the plants.
Congratulations, seniors. We're very, very proud of you. Feed me.
Hey seniors, I know that this year hasn't exactly gone according to plan, but we're all still so proud of you. Congratulations, class of 2020.
You did it, seniors. We know it's been tough, but your Little Shop family is very proud of you guys. You have grown from being bad little kids to beautiful young adults. Congrats, guys. You'll be a success.
Seniors, seniors, congratulations and good luck. Seniors, seniors, congratulations and good luck. Remember, don't feed the plants.
Congratulations, seniors. Wishing you good luck and success. Stay safe.
Hey seniors, it's me, Courtney. I just want to say congratulations on finishing high school. Now remember the quote, YOLO. You only live once, so go out there and be the best that you could be.
Hi seniors, congratulations on your graduation. You are my hero and my inspiration. Make a shine on our island. We love you so much. Hey!
Hey, it's Kim. I'm just here to say congratulations to the class of 2020. I know it's been a rough 4 years. Believe me, I've been there. I just want to say stay cool, stay safe, and I might see you later.
Viva seniors of 2020! Keep on rising and shining like the bright stars that you are. Congratulations!
Good job, seniors, do-do-do-do. Good job, seniors, do-do-do-do. Good job, seniors, do-do-do-do. Good job, seniors. Congratulations, do-do-do.
Congratulations, 2020 seniors. You completed high school. I'm so proud of you guys. You killed it. Wish you the best of luck for your future. I hope you guys get an amazing job. You guys work hard, go to college, do whatever you guys are going to do, and you killed it. You will kill it. Congratulations. I'm so proud of you.
Alright, you got good grades. You're just so bright. You gotta wear shades. Congratulations, seniors.
Congratulations, seniors! We're very proud of you. Go out and do great things. Oh, it's Miss Liz. Okay, bye!
Congratulations, seniors! We are so proud of you, and I know this year probably hasn't been the best, but just know that there'll be many more wonderful years to come.
Congratulations, seniors. Though this virus is keeping us from meeting together face to face, what we can learn from this is perseverance. I want you to use that to make this future a better place for the next generation to come. Help make spreading greatness. Love you guys. Heart.
And my name is Ollie. My name is King. And together we're here to say happy graduation. And to the class of 2020. We're sorry we're in quarantine, but we could all fix that if we flatten the curve and stay home. Wash your hands for 20 seconds. And we all love you. And stay safe. Bye. Bye.
Yay! Congratulations, seniors. We're also very proud of you and wish you good luck in your future, whatever it may be. Remember, there's no script in life, so live it your best. We love you.
Congratulations, seniors, for graduating this year. You guys have gone through such a long journey through the years, but I hope you guys know that it isn't the end.
To the class of 2020, we are so very proud of you and your achievements. Congratulations. Best of luck on your next adventures.
Hi, seniors. It's Miss Liz and Mabel, and we just want to say congratulations, and we're going to miss you a whole lot. We know you're going to do great things, and we're so proud of you. All right,
Woo! Go class of 2020, you did it!
Hey seniors, something we cooked up, hope you like it. All of you seniors, you've reached your goal.
You remember that total eclipse of the sun a few weeks ago?
I was working in the wholesale flower district that day.
And we passed by this place where this old Chinese man, he sometimes sells me weird and exotic cuttings.
Cause he knows, strange plants are my hobby.
He had nothing unusual there that day.
No,
And I was about to, walk on by.
good for you.
When suddenly, without warning, there was this total eclipse of the sun. It got very dark.
Then I heard this strange humming sound like something from another world. And when the light came back, this weird plant was just sitting there.
Oopsies.
Stuck in, among the zinnias?
Audrey too.
Now, I could have sworn that plant hadn't been there before.
But the old Chinese man sold it to me anyways.
For $1.95.
Stuck in, among the zinnias?
Now, I could have sworn that plant hadn't been there before.
But the old Chinese man sold it to me anyways.
For $1.95.
Half a day. When it comes to applying for unemployment benefits, as it relates to the Pandemic Unemployment Assistance and Federal Pandemic Unemployment Compensation programs, the first thing you'll need to do is create an account and register on HireGuam.com. Utilizing this button rather than the Not Registered button at the upper right login box will ease the pool registration process as it was built specifically for the pool program. The first page you'll see is the welcome page that explains the pool program and the 10 scenarios of eligibility that caused unemployment. Read through it entirely, and if any pertain to you,
Feed me.
Does it have to be human?
Feed me.
Does it have to be mine?
Feed me.
Where am I supposed to get it?
Feed me, Seymour. Feed me all night long. That's right, boy. You can do it. Feed me, Seymour. Feed me all night long. Cause if you feed me, Seymour, I can grow big and strong.
You eat blood, Audrey, too. Let's face it. How am I supposed to keep on feeding you? Kill people?
I'll make it worth your while.
What?
You think all of this is a coincidence, baby? There's some success around here. And your adoption papers?
Look, you're a plant. An inanimate object.
This is looking at me to your punk!
If I could talk and I can move, who can see I can do anything I want?
Like what?
Like to live a pal. I just want to see everything. Your sickly, greasy heart desire. Would you like a Cadillac car? Or a guest shot on jackpot? Got to do with hanging Lamar, you're gonna get it. If you want it, baby. How'd you like to be a big wheel? Lining out for every meal. On the plan that could make it all real, you're gonna get it.
You're gonna get it.
I'm your genie, I'm your friend. I'm your winning sled. Take a chance and feed me. You know the kind of eats kind of red hot treats, kind of sticky little sweets I crave. Come on, Seymour, don't be a putt. Trust me, your life will surely rival King Tech.
Yeah, show a little initiative, work a bit of dance, and you'll get it.
I don't know. I don't know. I have so many strong reservations. Should I go and perform mutilations?
You didn't have nothing to let me. Come on, kid. What would it be? Money? Girls? One particular girl? How about that Audrey? There must be someone you can 86 foot quite like and get me some lunch. Think about the room in the Ritz. Rappers in belly covered in glitters. The little look you're gonna clean it all.
Get it, get it.
Gee, like a Harlem machine, moving around like I was James Dean, making all the guys on the corner turn green.
Go get it, if you wanna be profound, you really gotta justify. Take a breath and look around. A lot of folks deserve to die.
Wait a minute. That's not a very nice thing to say. No, I don't know anyone who deserves to get chopped up and fed to a hungry plant.
Sure you do.
Stupid woman! Christ, what a freaking scatterbrain!
I'm sorry, Doctor! I'm sorry, Doctor!
Now get the heck in there and pick up your dumb sweater, you dizzy cow!
Yes, Doctor! Right away, Doctor! I see no elephants better here before.
Come on, move it, you little slowpoke! Don't you like that stupid game? Forget the freaking sweater. Christ, if your stupid head weren't screwed on!
Oh, that hurt!
Move it!
If you wanna rationale, there isn't very hard to say. Stop and think it over, pal. The guy sure looks so painful to me. The guy sure looks so painful to me. The guy sure looks so painful to me.
He's so nasty, treating her rough.
Sucking her around and always talking so tough.
You eat blood and he's got more than enough.
I need blood and he's got more than enough.
You eat blood and he's got more than enough.
So go get it.
Lift up your head, wash off your mascara. Here, take my Kleenex, wipe that lipstick away. Show me your face, clean as the morning. I know things were bad, but now they're okay.
Suddenly Seymour standing beside you. You don't need no makeup, don't have to pretend. Suddenly Seymour is here to provide you sweet understanding. Seymour's your friend.
Treating me kindly, Daddy left early, Mama was poor. I'd meet a man and I'd follow him blindly. He'd snap his fingers, me, I'd say sure. Suddenly Seymour, standing beside me. He don't give me orders, he don't condescend. Suddenly Seymour is here to provide me sweet understanding. Seymour's my friend.
Last till forever. Tell me the bad times are clean washed away.
Understand that it's so strange and frightening. Losers like I've been, it's so hard to say. Suddenly
Seymour, he purified you. Suddenly
Awesome.
Congratulations.
Biba class of 2020.
Great job, Ernest.
Bree, don't leave me hanging on the Biba, man.
Biba.
Okay, all right. 9:53. Yeah, that was Ernest Achaco and the Gate Theater.
They were working on the Little Shop of Horrors production, but because of COVID-19, it had to be postponed. And so this was, I guess, a special message to the seniors that won't be able to move on with the production. And so they wanted to put this together, and we wanted to share it with you.
That boy really looked like Rick Moranis.
They sound so good.
Yeah, it's pretty amazing. So thank you to Ernest for giving us that. I'm just really glad to be able to put that out and kind of give him back something that COVID took away.
Mm-hmm.
And is it on YouTube? People want to go check it out, Bree?
Yeah, it is on YouTube. We'll probably share the link a little bit later after the show.
All right. And before we end our show on a good note, there were some big reveals during the Containing COVID broadcast. Dr. Hoa Wen of the Governor's Physicians Advisory Group called in and said 15 positives. They don't believe they're connected to the airmen who defied their superiors' orders. And he also said, as of now, it looks like these are 15 positives that might not even be connected to each other. And they're spread throughout the island. And so there's going to be some high-level meetings this morning. Another thing that we had talked about was Mayor Robert Hoffman, who's on the GVB board, had said there were going to be meetings, and there's a possibility the cleanup could be postponed. We don't know yet, just letting you know. And that it's going to be a huge effort. We're going to be involved here, right? We're right out here?
Yes, we signed up for the cleanup, and we're cleaning along here in Harmon.
Right. So that was another big one. There's currently one COVID hospitalization. It's a 61-year-old male who had checked into a local clinic yesterday, and then he was checked into GMH because of respiratory issues associated with being COVID-19 positive. Were there other things? We also spoke with the AG about his investigation into these airmen, and it's a really interesting because the AG's argument is basically that anybody who comes into Guam, because we're in a public health emergency, is required to do certain things, jump through certain public health hoops. And I guess the first thing he's trying to figure out is, did these airmen who might have come in from Anderson, did they do what was required of all incoming travelers?
And whether or not it's applicable
right.
to
that too.
people that come in from the Anderson Air Force Base.
Right. So there was that. Also, Sergeant Paul Tapau had said that they expect a break in the investigation into a hit and run that took place at the Sinania precinct.
Mm-hmm. He was mentioning that a complainant was coming in to file a complaint, and that the person of interest was somehow connected to the complainant. And it was a little confusing, right?
It was, yeah.
So he said it was a unique case in all his time at GPD. He'd never seen or heard anything like this before. So it should be an interesting release that they issue later on today.
Right. There was also some stuff that Dr. Ho had said, Bree, about our testing protocols for returning island residents and also those who are in quarantine facilities, the Government of Guam quarantine facilities.
Right. So the Government of Guam quarantine facilities, it looks as though tomorrow we're going to see people that are in these government quarantine facilities. They are going to be tested for COVID-19. And currently, the Physicians Advisory Group is working out the details, which could take weeks. Maybe by August, they might have everything squared away to offer testing out of home quarantine for residents.
And so how that would work is if and when it does get stood up, and it's not happening now, but if you were to come back to Guam, let's say from the States, you're required to do a 14-day home quarantine, but they want to do it so that they test you test negative, obviously. You'd be able to just go do whatever. You'd be able to go act like an airman.
Right, but but you'd have to pay for that. You would have to bear the cost for the testing. Right.
Okay.
There was something else. We talked about the retirement of Linda and Pingo DeNorsi.
That's right. There is something else. Man, so we hear there's going to be a new opening.
Yes.
At Adelup.
Right. We have no confirmation.
Official confirmation. Well, we've heard from many people who definitely are in the know about this, that we've received word that the governor's legal counsel has resigned And so we'll be following that story. Yeah, it's that's my me right now. I'm like,
Yeah.
overload.
So
So
that
we had
would
Tom
be,
Atta resign. It looks like the governor's legal counsel has resigned. Anne Marie Arceo has left the Department of Chamorro Affairs for a position at Commissione Fino Chamorro.
And if we want to go further back, go ahead.
Tony Babalta also resigned.
Pilar Laguatnia.
Pilar Laguatnia resigned. Samantha, are we going that far back?
No,
or are we going all the way back?
we're just during COVID.
During COVID.
During COVID, yeah.
Okay, yeah. So
Bobby
during COVID.
Alvarez is no longer.
Bobby Alvarez is no longer there. And so Arlene Santos, who had her share of issues with the Guam Public Library system, when I say that, the board just...
John Birch, sorry.
Oh, John Birch, yes.
Well, no, he didn't resign, but he was moved.
It's pretty much, I'll count that as a resignation. Yeah, so Arlene Santos was at the library, and the board pretty much, she didn't meet the legal criteria to serve as the director of the library system, and the board had pretty much flat out just refused to hire her. And so they've solved that problem by just taking her out of that situation and moving her over to the Department of Chamorro Affairs, where I think they have a board that's also got to approve her being there. So there are definitely some big changes going on in the administration. Everybody's talking about it. Does it have anything to do with the performance during the pandemic, or are people just kind of
stressed out? Yeah,
there was, I forget whose resignation it was, but maybe it was even Senator Regine. I mean, she didn't resign, she's not running. Yeah. So people are saying that during the COVID, you really put things in perspective and you think about what's important to yourself, to your life. And I mean, I don't know if that's just a nonsense excuse for all these people resigning, but I've had that thought, you know what I mean? Not about quitting, please, but just about what's important, because there's like, this is life or death. And so you do kind of think about those things, about what's really, really important. And so is that why people are resigning? Maybe they're thinking public service, not for me. I don't know. We'll find out. Or will we? Who knows? 10 o'clock. Let's end the show on a good note here. We're going to bring on Bernie from Matson. And we always end the show on a good note. And it's so easy to do because there are just so many people, businesses, organizations on this island that are doing things to give back and make it just a better place to be in. Bernie, welcome to the show. Good morning.
Good morning, Bernie.
Oh, let me...
Is Bernie there?
Yeah, she's there. Hi, Bernie.
Hey, good morning. How's the day?
Good morning.
First of all, before we get into the awesome work you guys did that we're recognizing you for, thank you for your donation to containing COVID. We got the bag of the masks, and there was some little cute hand sanitizer keychain things. There's also some wipes that we got. So thank you so much for that.
Thank you.
You're welcome.
Now everywhere I go, I'm like mask sponsored by Matson. And so we wanted to bring you on and kind of highlight this this great work and service that you guys did. We're going to pop up the pictures, and we'll go ahead and give you the floor. Tell us about this great thing you guys did. Just take us back to the beginning. Whose idea was it? What was the execution like? And then what was the response afterwards, Bernie?
Actually, good morning. Thanks for having me on. I can't take any claim for whose idea was it. This is the USDA program, Farms to Family program, it's called. And Mike Limpiaco of Pacific Unlimited is a subcontractor to a couple of companies in the States who received this contract. So it's really about passing out fresh fruit to the island. I think there's about 6,000 boxes that come a week. And Mike Limpiaco just gave us the opportunity to help with this program. It's really all the others out there that are making it work. We're just loaning containers and spending some of our time out there helping distribute when we can.
But you guys really are, though, there whenever our community needs your help. So just thank you so much. I know that, there are other things that you guys do. For example, with the Special Olympics.
Right.
Every time the Special Olympics comes around, you guys are always there front and center. And I know we've partnered on many different things with Matson over the years. So thank you so much for everything you guys are doing.
Man, you bumming me out, Bree. The Special Olympics, that was like the first big event that was canceled because of COVID. Remember that, Bernie? I was so just floored. I really wanted to do it, but of course they erred on the side of caution, and thankfully, looking at how things have turned out. But yeah, always good times there at Special Olympics, Bernie. And the great work you guys do. It's just a little piece of why we wanted to bring you onto the show and recognize you as our day's COVID heroes. Thank you, Matson.
Thank you. Thanks for the recognition. But like I said, it's all the other people out there making it work, right? I'm just lucky to work for a great company that supports the island and the community, and I'm, happy to give back to my island because this is my home too.
All right, Bernie. Well, I hope you get to wear Zori this weekend.
I will.
Okay, wash your hands, okay?
Wear a mask.
Thank you.
All right. Okay, see you, Sta.
Thanks. Have a good weekend.
You too. Bye. We just got word that the cleanup for the Guam Visitors Bureau has been postponed.
Oh, really?
Yeah, it's on the chat. I gotta wait till my boss Bree sees it, so it's totally official. But apparently, the lieutenant governor went on Facebook and made the announcement, which we had heard about here first on the show. And I was kind of like leery about talking about it because I didn't want to confuse anybody, but I only did because Mayor Robert Hoffman, who was on the GVB board, had said that it was a possibility.
Okay. All right. Again, Give Us a Moment cleanup this Saturday.
Give us a moment for the Give Us a Moment cleanup.
Right. Postponed.
All right. So there you go. Well, looks like my Saturday morning freed up. Sorry.
You can sleep in.
Okay, I can't sleep in. Now that I'm on this radio schedule, sleeping in, what's that?
Oh, that's true. You do. I do kind of get those phone calls and messages. Hey, what do you think about this? Dude, it's 6 o'clock in the morning.
Especially on Saturday.
I'm thinking I should be sleeping.
Right. I'm sorry, because on Saturday, it's like the only day I can really, and like when I sleep in, it's till like 5. I mean, that's like, whoa, oh my God, what happened?
That's true.
So I'm calling her on Saturday morning. I get up at like 3 just because my body clock is early, and I'm up at 3, and I'm like, hey, did you hear about this? So what about this? What is this? What's the matter? She's not responding. Hey, did you get my text? Oh, it's 4 a.m. Oh, it's Saturday. Okay. Oh, 10:07. Good job today, Bree.
Good job to you, too, as well.
No problem. Of course, to our callers, really thank you guys so much. Sometimes it's a tough run when they get on the air, but, they always call back, so we definitely appreciate that. Their part in helping us get out very, very valuable information. And also to our digital stream team, thank you so much to Jacob Salas. And we have some kings here.
Jacob Salas?
I mean, Jacob...
Sablan.
Okay, so can we just thank Kings real quick and our partners at Grab and Grub. Now, Grab and Grub is a great app. They also have an Instagram, and we've really, really been able to eat some good food and make the most of this pandemic.
Obvious.
Because of... Why do you think I dropped my chair down low?
That's why I have the laptop
No, but Grab and Grub, man, it's they've really brought us so much closer to a lot of places that we haven't been able to go to. It's a great app, especially for those of you guys who aren't ready to be dining out. You'd be surprised how many restaurants are on that Grab and Grub app. So this morning, courtesy of Grab and Grub and Kings, we have breakfast. Breakfast is
good.
Yeah.
Breakfasts.
So there's some bacon. I see some Portuguese sausage by request from Ken St. Nicholas. Of course, there's Spam. Looks like we got some eggs. And these are the French toast bites, I believe.
Oh, I've never tried those.
Right. Well,
but
guess
I'm about
what?
to.
You're about to. So, hey, guys, we're going to break bread. You guys have a great Friday, a great weekend. Remember, 15 new COVID-19 positives. So, as Dr. Wen and all the healthcare professionals we get on the show, as they always say, take this serious. Wear your mask. Wash your hands. Stay home.
Do not let your guard down, please.
All right. God bless you guys. Hey, for Sabrina Salas, Matanani. Hold on. Let me get my song ready, Bree.
Make sure to join us tonight for KUAM News Primetime. Nestor, Adriana, Jonah Gonçalves, Lacey Martinez, Tomas Menglotnia, our entire team. We'll have a really informative, there's lots of news going on today, as you just heard during our show. So make sure that 6 o'clock on KUM TV 8. And also, I don't want to
Relay for
the
Life.
virtual Relay for
Right,
Life
yeah.
tomorrow at 6:30 p.m. on KUAM TV 8, and also streaming on our social media platforms. It's something you really do not want to miss.
It's going to be awesome, and thank you again to the American Cancer Society and to all of the people, the teams, right? But
Yes, so beautiful.
really, all the people who took part in our TikTok
Dance
challenge, man. That was really fun, and I'm looking forward to seeing those videos. That's tomorrow.
That's tomorrow, 6:30 p.m.
Okay, so it's 10:10. Wow, 10 minutes to overtime.
Okay, we gotta go.
Okay, my name's Chris for Sabrina Salas, Matanani, and our KUAM family. Again, this has been Containing COVID. Have a great weekend, Guam. Está adios.
Bye.